At this time, I'd like to call the December 13th, 2023 Board of Health meeting to order. Roll call. Here.
Here. Ms. Langman. Here. Ms. Van der Ring. Here. Ms. Vincent.
Thank you. Next on their agenda is the adoption of the agenda. I've had the agenda for a week or so. Can I get a motion to approve?
I'll move to approve the agenda.
Second.
A motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
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 Opposed, same sign. All right, motion carries. Next item on the agenda is the approval of minutes. First item A is the minutes from the October 18th, 2023 meeting. Hopefully everybody's had a chance to review them.
I move to accept the October 18th minutes. Second.
We have a motion and a second. Any discussion or clarifications for the minutes? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item is the approval of the minutes from the November 8th, 2023 meeting.
I move to accept the minutes from October
November
8th,
November 8th.
November 8th, 2023 meeting.
Second.
We have a motion and a second. Any discussion or clarifications on this document? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is board president announcements. I don't have any announcements today. Thank you, other than Merry Christmas. Next item on the agenda, health officer's presentation and report. We've got two reports this month for October and November, right?
I don't have anything additional to add with respect to the report. I just wanted to make a couple comments about HFI, but before I do that, are there any questions?
Taking these one at a time. Any questions on the October report? Seems like I remember this, but do we need a motion to approve do we approve the health office report? No. Okay. Last chance for October. Any questions or comments on the November report? All right, next, would you like to?
Yeah,
Great.
So I just wanted to comment about Health First Indiana. I just wanted to say a couple of words before we start our process and continue to move through the agenda. The first was I wanted to thank everyone that applied and participated through this process. We had 43 different letters of recommendations, and it was an entire team within the health department that helped assess this. There was between 3 to 5 individuals assessing every proposal at any given time. We wish we could have awarded more proposals, but for those that weren't given a proposal or an opportunity to present today, there will be other opportunities to continue to collaborate within the department. One thing that I hope our community sees from today is the amount of excellent work that our clinical and non-clinical community partners have done, and we are all tremendously excited about some of these proposals, actually all of these proposals. And I just wanted to say thank you to our community and those that participated in this process, and also to the staff. And the health department was able to come up with proposals to utilize all of the funding that was approved by the board to be shared with our community partners. So that's the total of $973,755.46. So just wanted to say thank you for all of that work that's been done.
Great, thank you. Next item on the agenda is new business. Item 2387, discussion and vote of the Board of Health meeting schedule for 2024. I think you all have a proposed meeting dates in front of you. Does anybody have any comments, or can I get a motion to approve the meeting schedule as presented?
I move to approve the meeting schedule as stated.
Second.
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. That motion carries. Next item on the agenda, 2388, request for financial assistance, CHW Christmas Party.
Hello, we are requesting support to accept gift cards that have been donated by our community to have a party for our underprivileged teens aged 13 through 18. The donations total $1,440. The event is going to be this Saturday from 5 to 8 p.m. at the Boys and Girls Club. And a gift bag with a small gift card will be given to all attendees. And then the other gifts and larger gift card amounts will be given out or raffled throughout the event.
So the gift cards will actually go to the
The
kids. that are
teens,
13?
yes, yes. Yep, they were donated. They want to be donated to us so we can raffle them off and give them to the teens.
Sounds fun.
Sounds good.
How many teens do you expect to attend? Do you know?
50. Thank you, Renata.
Thank you.
No, it says that it's a community health worker holiday party. Can you tell us a little bit more about, I mean, it just sounds like an interesting aspect of what the community health workers are doing. Can we
Yeah,
get
certainly.
a few more details just about the party?
Sure, Renata Williams, Director of HEED, will address those.
So our community health workers who work so diligent and excellent in the community had identified the teenage range between 13 and 18 that was experiencing a gap. So what they did was reach out to a lot of their community partners within their census tracts, the schools, to help identify these children so that they could refer them to the Christmas party. And then they took the donations from the community partners to be able to host the event and have them come.
And it's at the Boys and Girls Club.
Correct.
Okay,
Awesome.
That's great.
thank you.
Anything else?
Anybody?
Okay.
All right. Thank you. I assume, Marcel, there's no legal issue with this or anything that would upset the council or anything, right? No, great. All right, can we get a motion to approve?
I move to approve the proposal of the gift cards given to the Girls and Boys Club for the party.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
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 Opposed, same sign. That motion carries. Next item on the agenda, 2389. HFSJC presentations, so the Health First presentations.
Yeah.
Great, thank you. Everyone can hear me. Okay. Thank you. I'm excited to hear from, I believe 19 of our our proposals tonight. And we will start first with our chronic disease prevention public health core service. And with that, I'm going to introduce Peter from the Bike Michiana Coalition. Just a little reminder, each participant will have 5 minutes to give their presentation. Board will have 2, maybe 3 minutes for questions. So that we are efficient, our presenters have been made aware of those guidelines. So Peter, you want to pop on up?
Do that. Hi, everybody. My name is Peter Rue. I'm here representing Bike Michiana Coalition, which is a umbrella group encouraging people to get out on bicycles for health reasons, exercise, et cetera, et cetera. The vision, excuse me, the true vision is both youth and adult health and safety. Most people don't ride bicycles, adult wise, don't ride bicycles because 70% of the people claim that they're fearful of it. As we all know, with chronic disease and obesity, bicycle riding is one of the healthier ways to reduce weight, but yet they're scared to get out there. So the presentation is to actually have classes. Oh, I forgot about that, sorry. Which button do I push? There we go.
Perfect.
Okay, so the vision is lifelong physical activity through bike riding and to create a system for safe bicycle riding throughout St. Joseph County as a whole. The program will use trained LCI instructors. LCI is the League Cycling Instructor, which have been trained by the League of American Bicyclists. The League of American Bicyclists have a curriculum. In fact, their safety program is one that they claim, and most people agree, is the safest program, and all other versions of it actually have the root and foundation on the curriculum that they put together over the years. The people who do the training, the league cycling instructors to become certified are both taught to both how to teach the class and what to teach. So how to reach the people. Got to pay attention to the time. The classes can be engaging to both adults and kids or youth. Part of the program really truly needs to be split that way. In the city of South Bend, as an example, 11.4% of the households in South Bend don't own a vehicle. That's a big number. So the way they get around is by bicycle. So safety for them. The plan is to use some of the partners we've worked with in the past. The Beacon Resource Center, Charles Black Center, the O'Brien Fitness Center. Do they get copies? Do you guys get copies of these slides? Or is this the only time you're gonna see them? Okay. So the reason why is Beacon Health System needs this assessment has found that bicycle riding and this is good for chronic disease support. Go on. See how I'm doing on time, about halfway there. The timeline is to become organized group of LCIs. This is current. We've already got them. We are already a bike friendly city. A lot of people are unaware of that. We're a silver rated bike friendly city. We've formed partnerships with a number of host organizations and we promote a number of bicycle events. So part of this is building that community that if you learn to ride, go ride with some other people.
Yep, the middle button again.
Yep. Okay. Oh, that middle button, sorry. All right, so in the spring, the timelines are to schedule the events, get marketing, begin to deliver some of the deliverables, some of the training, and then evaluate how we did. Then essentially a rinse repeat for the summertime, rinse repeat in the fall, and then report at the end.
Do your side arrow.
Side arrow. I'm doing good, aren't I?
Here.
I know I'm missing something here, and I've got 40 seconds left. Essentially, that's my presentation.
Very good.
Thank you.
Thank you.
Thank
Any
you.
questions?
So, are you going to focus, more on teaching adults to ride bikes, teaching kids to ride bikes, both? Will you have classes geared towards specific age groups?
Okay,
Okay.
actually,
Kind of several questions.
yeah,
I
yeah, no,
guess.
no, that's okay.
Yeah.
The classes are geared towards actually both, not together.
Okay, yeah.
So one would be for youth, other classes would be for adults. For almost any of them, if the classes become large, we've called for 2 league cycling instructors per class. We can bring in we have 30 bikes in our possession and helmets, so we can even provide the material to do the training with.
And are there any limits on who can sign up for a class besides the fact that you probably need to learn don't know how to ride a bike? I mean, can anybody in the county, are there any?
Absolutely.
Okay,
Yeah,
Okay.
this would be open to everybody.
okay. It's nice. Thank you.
Any other questions? Thank you very much.
Great.
It's hard to be first. Thank you,
It
guys.
is.
You did it. You did it well.
Yeah,
Thank
good-
you.
Good job.
Thank you.
Okay, great. Next, under chronic disease, we will have Indiana University School of Medicine South Bend. I'll introduce Dr. Mark Fox.
Good afternoon. Thanks for the opportunity to present this proposal from the IU School of Medicine South Bend, focused on chronic disease prevention. Cardiovascular disease is the leading cause of death around the world, in Indiana and in St. Joseph County. And so this proposal really focuses on cardiovascular risk reduction. No. If you have the magic touch. There you go. All right. And cardiometabolic risk factors refer to a collection of conditions that frequently occur together. And when they do, they dramatically magnify the risk of cardiovascular disease. Those conditions include hypertension or high blood pressure, dyslipidemia or abnormal cholesterol levels, diabetes or impaired glucose metabolism, and then overweight and obesity. And I highlight overweight and obesity because in the there we go. In the state KPIs, the call is for focus on obesity and obesity-related conditions. To give you a sense of the prevalence, these data are among U.S. adults. We have no reason to believe that they're significantly better in St. Joseph County than elsewhere, but 45% of U.S. adults have hypertension. In men, it's more than 50% have high blood pressure. In the Black population, it's over 50%. 14% of U.S. adults with diabetes, either diagnosed or not yet diagnosed. Estimates for dyslipidemia vary depending on what parameters you're looking at, but up to nearly a third of the U.S. population has some form of lipid disorder that contributes to cardiovascular disease, and 42% of U.S. adults essentially are obese. There we go. I feel like I missed a slide there.
Yeah. You have to go back.
So the Health First Indiana calls for a coalition focused on obesity prevention and obesity related diseases. So again, because obesity co-occurs and contributes to hypertension, diabetes and dyslipidemia, we feel that this cardiovascular risk reduction effort fits within that scope. The Heart Improvement Project really is a proposal to build a coalition of health profession students from across St. Joseph County. So led by the med school, but including nursing students from IU South Bend, St. Mary's, Bethel, Ivy Tech, and other health profession students that would also be able to participate. It focuses on conducting community-based cardiovascular risk assessments, specifically blood pressure, glucose, and lipids. Blood pressure everywhere because it's kind of the easiest and least labor-intensive and least and most cost effective. But glucose and lipids can be done in certain settings as well. But to conduct these not necessarily as massive, screen 300 people at a time at a health fair, but in conjunction with community partners such as food pantries, social service organizations, churches, employers, and other service providers. So barber shops, for instance, have been a focus for the 100 Black Men Initiative, as well as the iHeart Initiative in Indianapolis and other programs. So smaller settings that really enable the opportunity to help close the loop when abnormalities are identified. And that's our goal. We want to do more nationally. There have been efforts to encourage patients to know their numbers, to know what their cholesterol is, what their blood pressure and things are. That's one step of the process. We want to also include an assessment of health-related social needs along the lines of the social needs assessments done by the community health workers that addresses insurance status, food insecurity, and health literacy, but also to provide education regarding cardiovascular risk factors. And then finally, the closing the loop is to facilitate care navigation for those who need follow-up, to see a healthcare provider, and then to be able to share data with that receiving provider. And then finally, to ensure that we close the loop when patients have missed that scheduled appointment with a receiving provider to help facilitate follow-up of those missed opportunities.
John?
So the rest of the data shows, what the impact is in terms of core public health and opportunities for collaboration with the health department. But let me stop there and entertain what questions you have.
All right, thank you, Dr. Fox. Any questions, comments?
One thing that I thought was particularly interesting about this proposal is that it's using medical and nursing students. So, and so there's a benefit to them as well. Can you talk a little bit more about what the benefit to these healthcare students is in terms of their health education?
Yeah, great question. Thank you. They learn a lot in the classroom and certainly have the opportunity then as they progress through their training to extend that in formal clinical settings, particularly for med students and nursing students earlier in their career when they have less patient contact. This is a way for them to safely and meaningfully be engaged in practicing those clinical skills, practicing communication with patients, focused on health education. That's in some ways not as high stakes as in the hospital or things. So it provides them some supervised clinical experience that is appropriate to their level of training. And generally, they're really eager for some patient contact, but there are constraints on what they can do. So this is a reasonable but meaningful way for students to interact, but that also has an impact on the patients that they encounter.
And I'm assuming though the students will be supervised in some way
Yes.
and, okay.
Yep.
Any other questions for Dr. Fox?
I do have one question. I know there's a lack of primary care and physicians in the community. So do you have an idea like how that's going to work and how you will refer them? And do you have partners that are wanting to kind of join in with that?
Yeah, so, as you know, one of the biggest barriers is lack of insurance, and providers that are in a position to be able to receive patients without insurance are limited. So working with safety net providers across the region is a focus. We're in discussions with a number of them to be able to facilitate that, including actually our own student outreach clinic that the med school runs that has fairly limited capacity, but we hope to also be able to build that. So, my longer term vision is that if obviously I want this to continue beyond 1 year, and really to have an assessment of what the magnitude of the unmet need is and to build the capacity both through the student clinic as well as other safety net providers to help meet that need.
Great. Thank you, Dr. Fox.
Thank you.
Rutland.
Okay, great. Next is Portage Township, Jason Critchlow.
Thank you so much for the time today. I'm Jason Critchlow, the trustee of Portage Township. I'd like to acknowledge and thank our board chair, Mr. Shabazz, who's here with me. And it's just humbling being amidst all these absolute do-gooders. I was trying to come up with the right word for it before I came up here. And I mean, it's just really where I landed. So you guys are all awesome and making our community better. So our proposal is what we're calling eating healthy on a budget. I need this thing. So basically, Mr. Fox here, Dr. Fox must have been looking over my shoulder while I created some of these slides because preaching to the choir in a lot of this. But the problem that we are identifying here is poor nutrition. It's a common, serious, and expensive problem here in the United States, and especially here in St. Joseph County. Got some statistics up there. They're very similar. I've got prevalence rates on the next slide here that Dr. Fox had as well, so I won't dive into those. But all manner of illnesses that are related to poor nutrition, heart disease, stroke, type 2 diabetes, even some types of cancer. Interestingly, the estimated cost of weight-related illness in the US in 2019 was $173 billion, which is a lot of dough. Adults that are not at a healthy weight have approximately $1,800 in higher medical costs than those who are at a healthy weight. And really, nutrition is directly related to quality of life. So that's what we're talking about here. And we can't talk about it without talking about the disparities that exist. Again, Dr. Fox mentioned some of these obesity rates. Not everything is created equally. Obesity is more prevalent in the lowest income groups and the lowest educational groups. Portage Township is one of the largest townships in the state of Indiana. It's approximately 100,000 residents. The city of South Bend is encompassed almost entirely within the boundaries of Portage Township. 1/4 to 1/3 of our households are living at or below the federal poverty level. 40% of those households are non-white, 11.8% are without healthcare coverage. So why Portage Township really is about, Portage Township is already a known entity and trusted provider of services to this population. It's who we work with every day. We process thousands of applications annually. We will have done over $500,000 in a direct assistance just this year to this population. So it's a population we're very familiar with, that we work with on a daily basis. And we feel like we have built trusted relationships with. Where am I pointing this thing? Come on now. All right. So really, nutrition and limited resources, how those are related. Here are the issues, the nutrition related issues that come out of having limited resources, households with limited resources. Some of those have been touched on and will be touched on, but these are the barriers that exist. And the fact is, we can overcome some of these barriers with what amounts to be a very comprehensive educational campaign. And that's what we are proposing to do with this grant funding. So chronic disease prevention is what we're talking about. We do want to have a specific focus on these low income households. The goal is to decrease obesity rates and the comorbidities that are related to them. So it'll be a multifaceted educational approach. It will include printed educational materials, as well as some traditional video marketing with broadcast TV, cable, OTT, digital platforms. I'm happy to talk about what that is after this, but not just generally video marketing like you think of it, very targeted marketing. So specific materials developed for students, specific materials developed for adults. They process information differently. A key feature of our program is going to be a website. It's going to have tools on the website where households, individuals can go to the website, input things like their household income, their likes, dislikes, their household size, allergies, and it will help create a grocery bill or a grocery list. It will help identify places they can get those groceries, help identify healthy recipes, things that they can do at home, time-saving recipes, because a lot of these folks have limited time as one of their resources. Also, a key part of this will be informational sessions and cooking classes that will be facilitated and led by Portage Township. Those are going to take place in collaboration with lots of community partners, La Casa, Ivy Tech, Real Services, we're hoping as well. But there's a lot of the Kroc Center, a lot of places that have the ability to set those up, and we would facilitate them. So here's just some more details. I'm kind of diving down in each of those things that I already talked about as far as our approach goes. And our project timeline is we would start immediately. We would look to hire a program coordinator that would lead these efforts for us. The township is committed to supplementing the grant funding for that position. So We will provide benefits to that position as well as a portion of their salary. We would like this to be the start of something for Portage Township that we will then continue to do in the future, grow, see what it can become. We figure by March 2024, we can have all the collaborations in place, all our materials designed, ready to go. We hit the ground running in April, and we're doing this all year, serving the people that already come into our office, the places that we already go. And then, as I said, going out and seeking those collaborations.
Thank you very much. Any questions for Mr. Critchlow?
I think in the materials that we got, there was mention made of, sharing materials and maybe working with other St. Joe County townships in St. Joe County. How do you envision, other townships being able to, maybe work with you or to, use or some of these?
Yeah, it's a great
access some
question.
of these
Well,
materials?
basically, once we have kind of led the effort on the creation and development of the materials, we will go to the other townships and give them to them to distribute to their individuals as well. When we're facilitating classes, cooking classes, lots of educational sessions throughout the year, they will not just take place within Portage Township. Mishawaka would be a highly targeted area. That's our other urban center. Doris Porterly's over there, runs a food bank. She does a great job. So she'd be very interested in this. So basically, we feel like once we put the program together and we just go to the other townships and say, hey, we're doing this, let your people know about it, help us market it. That's really what it would come down to.
Oh, is this a program that, do you think that once you have it together, you could market it and maybe like a church with a food bank or another community center in maybe a smaller town could also adopt this?
Yeah, they certainly could. We work with all of them already. We're well known to all the social services agencies and churches and places that do that. So basically reaching out to them, we share information with them as it is. They share it with us. So 100% getting them on board with it and letting them offer it to their patrons.
Thank you.
Thank you. Any other questions?
I just have one question. So what guidelines and things are you using to determine what healthy eating is, like American Heart Association, or what kind of?
Well, that's where we would actually engage with the health department. We'd look forward to working with you folks to help us provide that guidance. We would want to make sure that we were working with nurse educators that are accredited, and all those type of things. So I come from the healthcare field, so I'm pretty familiar with a lot of that stuff. So we would really look to the health department for their guidance on that.
Thank you very much.
Thank you.
Awesome. Great. Thank you. Next, we have Carla with Real Services.
I am Carla Fales. I'm the president and CEO of Real Services, and we are both an area agency on aging, serving older adults in a 5-county area, as well as a community action addressing the needs of people experiencing poverty, also in a 5-county area. We just swap out Fulton County for LaPorte between those two. Oh, there it went. I was going to try to do it without any mistakes. Now it won't go back. There it goes. All right, so the program I'm talking about today is called Positive Action Towards Health for Seniors, or PATHS. It does address the Chronic Disease Prevention Core Public Health Service. And the specific KPI, Dr. Fox mentioned the first part of the KPI, which was related to developing obesity coalition. At the very end of that KPI, there was one that talks about using evidence-based practices to address obesity. And so our program is based on addressing that in a meaningful way for a segment of our population, which is older adults. In reference to older adults, we know that obesity alone costs the Medicare system about $147 million a year. And that 70% of all our healthcare dollars are related to chronic illness. And so as we look at this, the additional 2 KPIs, they're really focused on measuring specific indicators that are related to these evidence-based programs that I will tell you about, and then expanding access to them for individuals that may not engage with those type of programs in other settings. Long-term, we're looking at reducing the impact of disease. And for older adults, when we talk about reducing the impact of disease, it isn't always about preventing the disease. It's often about preventing the negative aspects of diseases that are not well managed. So, we're not going to always be able to reverse diabetes, but can we keep someone actively managing diabetes so that their outcomes are good? As an area agency on aging, people are eligible for our services at age 60. I've often said, I don't want to see you till you're 80 because you're so healthy, you don't need us. And that's really what we're looking for. We also want to use community education and programming that helps the seniors take control of that self-management. You know, we know there's lots of studies that say that people that manage their own diseases are more successful than those who don't take ownership of that. And that's really what we want to focus on. And then the two evidence-based programs are focused on disease prevention, and we want to couple that in improving those health indicators with a program that is called Produce for Better Health. It actually gets healthy fruits and vegetables into the hands of older adults that attend congregate meal sites. So through this, we will train leaders. Evidence-based programs require affinity and require you to maintain fidelity to their programs. So they're very strict on the training. You have to go through their training. You have to use their materials very specifically. And of course, to one of your comments earlier, yes, they market that and sell that. And so you have to invest in that as an organization. So the two programs, CDSMP or Chronic Disease Self-Management Program, and then SAIL, which is a new program for us, Stay Active and Independent for Life. One focuses on the disease management and education. The other one is actually an exercise program that also provides education. And then Produce for Better Health. We have a grant already to do this. It's very limited and we've had more demand than we're able to meet. We have access to buy the food. We don't have the funding for the staffing to go and actually do the classes before they get the box of food. And so through this funding, we're like, well, if we could pay a little bit more for that staff person, we can get more boxes out into the community because I have lots of money to buy the food. Our timeline is pretty straightforward. Get the folks trained, start offering the programs. Produce for Better Health will expand that in leading up into April when we start getting bigger boxes of foods. And then the SAIL program would start in May. We do need to identify additional partner sites. I'm going to plan one at Portage Township now. But we also are in senior centers, libraries, different places like that where seniors naturally gather. We don't have a large, well-established senior center. We have smaller, what we would call naturally occurring senior centers in our community. And that's generally our target for these type of programs. We want to go where seniors are. We have a very strong partnership with One Roof, their current location, as well as a new location in Mishawaka and another that will be in Northwest. And so we will continue that through the process. These outcomes are very specific. I wish I were this genius and come up with these in a very short period of time. These are the defined outcomes that come out of CDSMP and SAIL that has been proven through evidence-based programs through the studies through the universities. And so the changes in weight and balance and such are indicated here. And then we've been recording health and weight and other indicators for our Produce for Better Health and already showing some really good improvements in that area.
Great. Any kind of wrap up comments? Great.
Yep.
Any questions for Carla? Forgot her name. Any questions, comments?
I'm just curious, do you have any where, can you give us more names of possible sites or where you have current sites throughout the
Sure.
county? And are you kind of in more rural areas of the county as well as in the urban areas?
We are technically in 5 counties in some of these programs. Some of our stronger partners this year have been our libraries.
Okay.
We've also partnered with the Kroc Center. One Roof is another one. And so a lot of our focus will be in some of the zip codes. We've been running numbers on zip codes, and there's a few of those I think we need to reach out to because we know that there's a strong need. And so I always say, have program will travel. Anybody that would allow us to come into their environment, whether it's a church, a community center, township offices. The programs are very mobile. It's wherever you can put 10 or 20 people in a room, the program can be run there with the trained leaders.
Great. Anything else? Any other questions? All right. Thank you very much.
Thanks, Carla. Great. Next, we'll have Lauren Gorski from United Health Services.
Wait. Sorry, I think we're out of order.
Yeah.
Sorry.
United.
Oh, I'm so sorry. Sorry, Lauren. My bad. That's okay. Yeah, sit up front, my friend. You're next. Thank you. I had crossed St. Margaret's House off already, my bad. Miss Katie Elliott from St. Margaret's House.
How dare me, Katie, I'm so sorry. Quite all right. I didn't have an agenda anyway, so it's no different to me. Good afternoon, good evening. I'm Katie Elliott. I'm the Executive Director of St. Margaret's House across the street. St. Margaret's House has been in the community for 33 years. And we are a day center for women and children facing economic poverty in our region. We serve, in 2022, we saw 1,200 different women and 400 different children over the course of the year. And many of those individuals we see, regularly. And so we serve between 60 and 80 meals a day, or 60 and 80 individuals. And that's a continental breakfast in the morning and then a home cooked hot lunch at lunchtime. So the majority of this funding will go, all of this funding will go towards improving and expanding our existing food program. We can stretch a penny really far at St. Margaret's House, but sometimes that comes at a cost to the quality of the meals that we're serving. And we really, in response to affirming the dignity of every person we serve, it's important to us to serve the highest quality meals we can, especially in light of, as the folks who have spoken before me have said, the intersection of chronic disease and poverty. Most of the women who come to St. Margaret's House struggle with one or more chronic diseases. So to be able to improve the quality of their two primary meals of the day would be a huge advantage to both our program and ultimately to the women we serve. The funding will also go to, and I have the PowerPoint, but I don't. You're fearful of the clicker. Yeah, so is it okay if I just kind of tell you what's in my PowerPoint and okay. I'm better talking without PowerPoint. Thank you, Robin. So that's, we already went through that. We, at St. Margaret's House, in addition to meeting basic needs, we also offer programming and access to community resources. We provide comprehensive guest services to whatever a woman may need. And all in the context of a loving, supporting community, understanding that a woman really can't heal and take her next step if she is not supported unconditionally through those steps. So this funding will go to improving the quality of our meals and providing our guests with improved educational opportunities, both on site. We have after 33 years, we have countless partners in the community, but one of our prime partners for nutrition is with the Purdue Extension Master Gardeners and as well as Unity Gardens. So we would like to really expand what we do with those two groups and also incorporate field trips for our women who often, who lack, as has been mentioned before, transportation and don't have the opportunity to get outside of downtown South Bend or their neighborhoods where they live and take them on field trips to some of our local growers. And we did this with great success in the fall to Prairie Winds Nature Farm south in Lakeville and would like to replicate that. So some of this funding would go to provide bus transportation for the women as well as a stipend to the place where we go. Nope, that's okay. So we, just in summary, I'm trying to see if there's anything there I haven't already shared with you. It's important for our kitchen manager to continue to grow in her nutritional education. She manages the menu for the month. And when she already has a relationship with nutritionists, but we would really like to sort of support her even more in that because there's a fine balance between what's on the plate and then what our guests will actually want to eat. And so providing a nutritionally balanced meal that's also culturally attractive and acceptable is a fine line. So she's constantly working with nutritionists to figure that out. So we'd like to encourage her with that. And then we recently hired a part-time data analyst and grant writer at St. Margaret's House to really help us. We are a gospel-based mission and that doesn't lend itself easily to quantitative data. So we are trying to take steps in that direction. And we recently hired someone who's going to help us with our data analysis in the hopes of being able to support the Department of Health in thanks for this funding with better data, because we do see at St. Margaret's House the most vulnerable women and children in our region. And so it's really important to have accurate data about what's going on in their lives. So that's another component that we hope to achieve with this funding. Let's see, Robin, what else?
Yeah, I'm trying to figure out where I need to point the pointer, but we got it.
And also just breaking down the barriers to good nutrition for our guests who live in poverty, and making more of healthy, locally grown, fresh produce available to them through these field trips and through the relationships they'll form on site with the people in the field trips.
Very good. That's wonderful. Thank you. Any questions for Katie?
Thank you.
One thing that I wasn't quite clear on, but I'm curious about is, will the women have opportunities like on these field trips to actually learn how to work in the garden, or to go in the kitchen and actually learn how to help prepare these meals?
Yes.
If nothing else, I find those things to be sometimes very mentally therapeutic. So
Yeah, and in October, when we went to Prairie Winds, Charlotte Wolf, actually, the owner of Prairie Winds, actually had the women harvest their lunch from her gardens and then prepare them in her farm kitchen, and then they enjoyed the lunch together. So yes, there's very much a hands-on, tactile experience. And there were 25 women on that trip, and for 20 of them, they had never experienced, anything outside of South End like that. So it was they came back on cloud nine. Yeah. And it really showed us we need to do more of that.
That's great.
Yeah.
Any other questions or comments? No, thank you very much.
Thank you all.
Thanks.
Thanks.
Okay, now Lauren, it is your turn. Lauren Feetskorsky with United Health Services.
Okay.
All right. Hi, my name is Lauren. Thank you so much for having me. I work for United Health Services. And we, again, we are in the category of chronic disease prevention, the establishment of a healthy community coalition that has comprehensive and evidence-based for obesity and obesity-related prevention. I'm gonna do the same thing as everybody else.
Yeah.
Maybe.
I'm not sure where the point is. Just keep hitting it. It will go.
No?
The projector.
Right there.
Oh,
I know it used to be difficult.
all right. Forward button, right?
Jenny, will you just advance it?
Okay, all right. Thank you. United Health Services was founded in 1966. We've been in the community for over 55 years. We're a 501c3, and we have multiple programs underneath the one roof. So UHS doesn't do anything, but all of our programs are out there doing awesome work all the time. And in our mission statement, I put it up there because one of our things is to seek collaborative solutions to emerging health needs. So we also run 3 great state grant projects, the breast and cervical cancer program, but more importantly, our Indiana Wise Women program, which is well integrated screening and evaluation for women across the nation for the northern region of over 27 counties. And the Healthy Hoosier program, which is a CDC funded grant for the COVID grants. Indiana received that money for with the COVID grants. And we are the Northern Regional Healthy Behavior Support Services program. So, and this is a patient, then what? All right. The program is for screening and intervention, and then prevention program for chronic diseases, often associated with diabetes, hypertension, and often associated with obesity, hypertension and diabetes. It's based upon the Healthy Hoosier program was based upon the Indiana Wise Women program, but that grant is a short grant and there is no more screening for that grant. The screening ended in mid-November and the grant ends at the end of April. And there is no funding right now to replace that grant in any of the counties that it's taking place in. Currently, the partners for that grant our United Health Services and HealthLink, which is our federally qualified health center across northwest and north central Indiana. And we will be partnering with them on this grant. They're providing the clinical support. So all their nurse practitioners and physicians who have already been running this grant through the Healthy Hoosier Group. And United Health Services would take over the admin as well as all the support services we're already doing. We also refer people automatically to CDC approved evidence-based programs, TOPS, Eat Smart, Move More, individualized health coaching, Healthy Heart Ambassadors, blood pressure self-monitoring program. I hate that one. The BPSM program are all the ones that fit within the timeline of this grant. We also normally refer to diabetes prevention program, which United Health Services is an agency of, but doesn't fit our timeline for this grant. Obviously, the community project impact is healthy changes within a person's life, decreased risk factors, including obesity, A1C percentages, blood pressure monitoring, increased knowledge of physical and nutritional activities. Every smoker receives smoking cessation information. Every uninsured person can be screened either by the navigators of HealthLink or United Health Services has certified Indiana navigators on staff as well. And generational health, because we know the adults are the ones who are helping all the households become healthy and their habits transfer on to the youth of the household. And of course, every person will be linked to continued programs, whether it's the coordinator helping them get into a gym membership for a free year for their whole family, or whether it's getting them into a DPP program, diabetes prevention program, and links to the community health workers, both at the county level and at HealthLink. So kind of to get you through a timeline, a client eligibility, we're gonna do 50 clients with this program. They have to live in St. Joe County, 18 above, 250% of poverty and below. They are HealthLink patients because that is who our clinical partner is. Because we're already partners with them, we can start the second week of the grant because we've already been doing this. So they get a health appointment where they get all their screenings, their class tech machines, so the provider has it immediately, the A1C, as well as the lipid panel, BMI, double blood pressure, risk average, and risk reduction counseling by their medical provider, referrals to medical management appointments, or if it's alert values, we use the CDC and American Heart Association alert values. And they get a take-home kit of like small activities, like a couple weights and some of those stretch bands, as well as instructional of how to use those items immediately. They are then they do a health self-assessment, and once they give us all their knowledge that they currently have and their attitudes towards health, and then we receive that through REDCap, and they also do all the privacy stuff as needed, so that we can score that, and then later on after the program, they do it again, and we can compare the scores of that. The coordinator then from United Health Services reaches out, offers them those programs, the grant pays for those programs if there's any cost, and then the rest of their allowance, we get to buy them home gym equipment, or we get to get them gym memberships directly, which is really fun for our coordinator.
Right.
And then we follow all those cases. And then after they've completed that, they go back in 5 to 6 months later for their rescreen at the facility, and that with their provider again, and the provider has a report of what they've been doing in between the two appointments.
All right.
Thanks, Lauren.
Thank you very much. Any questions for Lauren? No, thank you.
All right.
Thanks.
A lot.
Okay, next up, we have Sarah Stewart with the Unity Gardens.
I am Sarah Stewart and I'm scared of this clicker. It doesn't count if it minus the time. I'm Sarah Stewart with Unity Gardens, and it's particularly gratifying to be able to present to you all as a public health nurse. I feel like in my element, and I absolutely love this. Hey, Robin. Want to do something collaboratively? Yep, very good. In the last 15 years, Unity Gardens has been committed to wellness of our community. Through that time, we've been able with our community partners, basically businesses, nonprofits, health departments, cities, help Everyone has contributed to the idea that we can do 40 free pick gardens, we can do all these classes. But particularly we're at a point now where we have infrastructure, real indoor bathrooms, which is not on the PowerPoint. However, the Welcome Center, as you can see here, where we can host our own classes, the Geodome 4-Season Growing Dome, where we can grow food all year round, and the Edgy Veggie on your left there, that takes our best programs, takes them on the road, our accessibility features, and our, even you could see a few of the urban orchard trees. Yes, please. Thank you. With the help of our community, we've been able to create all this impact and connect particularly with underserved populations. Because of our proximity in the community, we develop the relationships with people in poverty. And in poverty, the driving force of healthcare changes or even just behavior is through relationships. And so that's plays to our strength. We have garden guide programs, harvesting help. And what happens is people find the joy in tasting and picking free food. Then they actually come back and they accidentally incorporate healthy food right into their diet by attraction rather than promotion. Click. By destigmatizing the idea of free food, we create a fun experience. It's great to be at Unity Gardens. It feels good. And by erasing the line between those who give and those who receive, we create this dignified free food experience that people want to come back. It's inclusive, it's accessible, and it's educational. Next. We're growing our effectiveness in all the key areas that Unity Gardens dovetails with. We're growing more food through the Geodome with 4,000 square feet of year-round growing space, in addition to our 7-acre garden or the other 40 gardens. We're creating a wellness not only for healthy food, but in mental health with creating 20 new green spaces, which have anti-anxiety effects and mitigate depression with soil. So we know we're connecting people to nature. And then creating opportunities. Imagine the joy of the kid who is a passive or an active learner, traditionally sitting there in school, fidgeting around, versus when they walk in the Geodome and can use all their senses to explore and enjoy and taste and smell and reignite that curiosity. Or with the reentry men who have barriers to real employment and have never experienced the joy of giving back or how it feels to volunteer and be part of the positive journey. So literally, we're growing wellness through opening hearts and opening minds. Click. Thank you. You can see the joy is palpable here as we connect to kids, families, and individuals in the garden. It's fun. Why wouldn't you come back? And then when you're back, might as well grab a bag of kale. This unique space for the Geodome surpassed even our experiences and expectations. It is the first geodesic off-the-grid dome in the entire Midwest, the first one open to the public in the entire United States. Click. Built with the help of the Reentry Center. And isn't that cool? Oh, I just still love it. 4,000 square foot of food where you'll see jackfruit trees, coffee plant. We've got a dragon fruit, papaya growing right next to the kale, tomatoes, spinach, basil. The sky's the limit. We don't know. But in addition to teaching horticulture, we get to teach renewable energy. There's passive solar, active solar through the South Bend's Easy Grant. We have geothermal tubing, and then we have a heat sink aquaponics pond. Even 4-year-olds can understand renewable energy and its effect on climate change through this structure. And if you look at the bottom left, you'll see actually that it's guided where we can host 30 kids easily right there in that place, designed by the Reentry Center. Click. Yes, the Edgy Veggie. Watch us be on the road. Talk about infrastructure. Started again in 2023. In June was our first visit. We can take our best programs on the road now and encourage other people to do Unity Gardens. We've done Click. Marshall School did their Unity Garden and started it through that. Boys and Girls Club. We did Art Beat, Linden Market. We teach things like tasting, herb tasting and smelling, composting, not yet, but that's okay. Composting, vermiculture, all sorts of stuff. It's kind of like speed dating, but education. Go ahead. Oh, you're already there. Then our urban orchards. This is in collaboration with Giving Grove, a national company dedicated to doing urban orchards in different cities. An orchard can be a group of trees, nuts, fruit trees, nut trees, or berries. So we are going to do 20 of those in the next 2 years, where we'll create new green spaces and over 8,000 servings of fruit once those trees mature.
That's
So
awesome.
that,
Very cool stuff. Any final?
okay, no problem. Any questions?
Yeah, any questions?
That's 6 minutes and 11 seconds. It's okay.
My specific question was, because I can tell you, you do a lot in community gardens, but, what specifically are you hoping to do with the grant money?
Absolutely. So the grant money pays for a dedicated educator that will take on the Geodome, the urban orchards, and the Geodome, urban, and Edgy Veggie programming. It pays for summer interns, which are seasonally necessary for growing all that food. And on Edgy Veggie, we usually have 6 stations. So when I say it's like speed dating, it really is. There's stations and we keep the kids active. So we hit about 400 kids this summer just testing the program.
Did I see in your information that you touch like 12,000 people a year or so?
Easy,
Yeah.
which is, I thought we were like a baby nonprofit, but that's actually pretty good.
Mhm.
Yeah, we have hundreds of people every day that come out to the main Unity Garden. But then we also have the 40, we're not even counting that in there, classes and programming too.
That's great.
Thanks.
Any other questions, comments? Thank you very much.
Absolutely, my pleasure.
Thanks, Sarah.
And thanks for getting me the clicker.
Okay, next we're moving to the core public health service, infectious disease surveillance and prevention. And with that, we'll have HealthLink.
You want a next slide for me too?
Oh, gosh. Yes. Oh, yes, it's really good. I can.
Okay. Hi, everyone. Thanks for this opportunity. I'm Josh Kellums with HealthLink. I'm our specialty services director. I brought our chief operating officer and our grants director for moral support and to help field questions. So next slide. Okay. HealthLink is a federally qualified health center. We operate in 5 counties, in many sites in 5 counties. Several sites in St. Joe County, one in Mishawaka, one on our southeast location is on High Street. We have a location in the Centennial Building in Memorial. And then we also see patients at IUSB. So, and we see about 41% of our patients here in St. Joe County. For this program, we'd like to use what we learned with another hepatitis C grant and sort of expand that into sexually transmitted infections, HIV, and enhance what we're doing with hepatitis C. Next slide. And here's the information about the KPI, which is pretty vague, but it's to provide testing and counseling for HIV, hepatitis C, and other STIs. Stuff we already do, but we want to really coordinate that care and make sure it's done in all of the health centers where we see patients here in the county. Next slide. Yep, we have 3 main objectives here. One is to work to enhance or implement an expedited partner therapy program, which expedited partner therapy, if you're not familiar, is to work with patients who come into the clinic, are diagnosed with an STI, and then have to inform their partners that they have an STI, so we can prescribe medications for those partners as they leave the building without everyone having to come in, see a provider, and then go through the process of getting set up and going through the pharmacy and all that. So that's something that we're excited about. We also want to offer rapid testing for patients for HIV and HCV, so that's hepatitis C. So right now we do testing, but it's not rapid. So patients get the testing, they have to be called with their results. We want to make sure that we can offer rapid testing so they can get their results in a timely manner, so we don't lose them to follow-up care. And then our third objective is to really enhance the connections for HCV and HIV and STI, so that patients can get connected with resources, enter treatment options if that's what they need for HIV and HCV. And so with that, we're really focusing on training our medical assistants, nurses, and then adding a community health worker who specifically works on this program. Next slide. Okay, so here I just took each of the objectives and broke those down into some of the activities that we'll be focusing on. Many of the activities are similar for each objective. Training, educating our providers and our support staff, working with our pharmacy to make sure that the pharmacy and medical pieces are integrated, that things happen seamlessly. Working with our CHW to get up to speed on what the resources are in the community, and even creating some outreach materials so patients know that they can come to HealthLink, they can get tested. We have that expedited therapy, which is relatively new and innovative. And we also, with our current hepatitis C grant, we do some testing out in the community. So we want to make sure that we're able to offer that as well. And then for each one, I put the targets and what we plan to see as far as outcomes go. Next slide. Yeah, so you see something similar here for the rapid testing. We need to procure these tests, train our MAs and RNs are the ones who will be actually performing the tests, because they are different than the venous draw that we do with the current testing. We also want to make sure that the patients are educated, our providers are educated, and then work with the community through outreach events. And then you can see the impact that we plan to have there. And then for this one, we already do a lot of tracking for HIV and HCV, but this one has more to do with finding a community health worker, training that person up, making sure that they then can form the connections in the community with the patients who are diagnosed with hepatitis C and HIV, because treatment, early fast treatment is key for those. So that's what we want to make sure we do there. Okay. And for a real quick view at the timeline, we don't really have targets for as far as dates go for these, but we do want to, we have to prioritize how we do some of this work. So it's about finding the CHW, hiring the CHW, training staff, working with our pharmacy, and then we can work on the rest of those activities after that. And of course, we want to evaluate, sustain, and report. And that's it.
All right, thank you very much, Josh. Any questions? All right, good stuff.
Really, no questions? Okay. Great.
Awesome,
Thank
thank you. Okay, great. Next we have Street Medicine South Bend. I believe Dr. Callahan is here to present on that program.
You mind advancing for me, Robin?
I do.
Thank
I'm
you so much.
gonna be the
appreciate that.
advancer, yes.
I'm Kate Callahan. I'm an associate director at Memorial Family Medicine Residency Program, and I'm the medical director of Street Medicine South Bend, which is an outreach of our residency program. And I'm going to talk a little bit about point of care Hep C testing that we hope to utilize if we receive the grant. Second over.
Yep, there, yep, right next to the orange one, Jenny. There you go.
Perfect.
Thank you.
So just a little bit of history of what, you can go next slide.
Maybe.
So just a little bit of history of what street medicine really is. This was actually started in Pittsburgh, Pennsylvania, by a physician named Jim Withers. And it really seeks to meet individuals experiencing homelessness where they are, recognizing the significant stigmatization that this population has faced in healthcare, and the reality that we really need to build trust before we can do anything else to help these folks, medically speaking. Next slide. Street Medicine South Bend was founded by our residency program about a year ago. We started in December of 2022, and we run a drop-in clinic at Motels for Now, which is our low barrier shelter here in South Bend. We seek to bridge the gap between individuals experiencing homelessness in our community and the healthcare workers in our community. And we do that by providing quality medical care and resources to them, sanitary resources, socks, those kinds of things. And one really cool part of our program is that we include residents in this. So we're training future healthcare leaders to care for this population in innovative ways. Again, we do our work over at Lincoln Way West at Motels for Now. And we've seen 95 patients in our first year of work and about 165 encounters thus far. Next slide. as has already been stated by our folks from HealthLink, we're going to be speaking to the infectious disease surveillance and prevention piece. And the KPI is exactly the same, providing testing and counseling for HIV and Hep C care. Why is this relevant to our county? So the CDC says that Indiana has the 5th highest rate of Hep C in the country. And on a literature review in 2019, we found that Hep C infections among those experiencing homelessness was around somewhere between 9.8 and 52%. So extremely high in the population that we seek to serve through our services. This is based on a protocol that's being utilized by Street Medicine Kalamazoo, our proposition. So we would be using these OraQuick point of care HCV tests, which are finger stick tests that we'd be able to do in the field, similar to what our folks at HealthLink have discussed, and report any positive results that we have to the county, obviously. Then we would have any folks that have a positive result come and present to our residency clinic, and the residents would serve really as a Hep C consultant, which would be both an opportunity for these folks to receive the additional testing that they need, follow-up testing that would need to be done before treatment was pursued, and then also to give our residents an opportunity to really manage this. So educational, and then also meeting the need of the community. The main reasons we're hoping for this grant are to buy the testing supplies and controls, and then also Street Medicine Kalamazoo has found that gift card incentivization with weekly treatment is really helpful in ensuring that folks complete the full course, which we don't want to increase resistance with this project. Our goals, I've really already stated those first 5 points, so I'll just hop to our main goal, which is to screen 100 individuals over the time period of the grant over the course of the next year. And we'll be evaluating that on a quarterly basis as to whether or not we've accomplished that goal. Next slide. This is just a workflow to demonstrate kind of that point of care test. And then the Street Medicine Kalamazoo protocol has found that giving medications a week at a time has helped with adherence to treatment. So sometimes folks will lose this medication, and unfortunately insurances are not willing to provide a whole nother set of these medications because they're extremely expensive. So by administering these in a week of dosing at a time, they've found much better adherence, and that would give us an opportunity to provide that gift card and then incentivize at the end with a $20 gift card for completion of treatment. And in terms of timeline, so we're currently applying for a lab waiver, CLIA lab waiver, which would allow us to administer this point of care test. Once that application is received and accepted, we imagine that'll be done in the middle of January. We would then begin administering these tests. Imagine that would be from about mid-February to about November 1st. As soon as we had a positive test, we would get those folks an appointment at our residency clinic and then move forward with treatment based on the results of those labs. These are my references, and I'm happy to receive any questions that you all might have. Thank you so much for your consideration.
Great stuff. Thank you. Any questions?
Now, you're physically based at the Motels for Now site, correct?
Yeah, so our services we provide are at Motels for Now in a physical room there. We utilize the same room that Oakland utilizes at Motels for Now.
So is it just Motels for Now residents?
I can't really hear you. Can you go to the microphone?
So yes,
Is it just motel, or can
Yeah.
other people who aren't part of Motels for Now, do they?
we would receive anyone who shows up for care.
Okay.
I will tell you the vast majority of the individuals that we care for are residents of Motels for
I
Now.
mean, that's where you have a concern about wanting to find and treat Hep C.
That would be our primary target audience. But again, if someone were to present to us for care, we would be more than happy to administer this test to them as well.
And if they get a positive test, do you have a good response to people coming and getting treatment, like with the gift card incentives and other things?
Yes. Yeah. Honestly, I mean, I think folks, in terms of follow-up, we've actually partnered with HealthLink a great deal in terms of connecting them to primary care. I don't have an exact percentage for you in terms of follow-up for those visits, but from conversations that I've had both with their office manager and then in addition to the colleagues the physician colleagues that I have that are caring for those patients, the response rate has been very significant for showing up, and they really only have to come to the office one time and then we'd be able to go to them, which again increases adherence by actually going where they are.
I guess this is the last question. I'm just curious, that was the question I had was, if you have to go off-site, is there a transportation?
Oakland provides transportation to any medical visits for the individuals staying at Motels for Now. Yeah. Thank you all so much for your consideration.
Thank you very much.
Thanks.
Awesome. Thank you. Next, we're transitioning to the core public health service, maternal and child health. And next speaker up will be Beacon Health System, I believe, Kristen.
And I would like you to.
I got you.
Good evening. I'm Kristen Marsh. I am the manager of early childhood services at Beacon Health System, Beacon Community Impact. Today, we're going to be talking about addressing prenatal and postpartum hypertension. So first, we're starting with the health first requirements. So our core public health service is the maternal infant health section. And our KPI for health first is increasing access to prenatal and postpartum care, encouraging equitable and community-based maternal and infant care. So Beacon Community Impact, our family infant support program that we currently have, which a lot of you know it as prenatal care coordination, which has been going for 20 years. We kind of rebranded at the beginning of the year just because we want to incorporate the entire family, not just maternal child. So we've been around for over 20 years. Our program has, we just rebranded the name. So our need in 2020, there was 92 pregnant associated deaths among Indiana women. 522 infant deaths before their first birthday. In 2022, there was 116 high-risk pregnant mothers diagnosed with chronic hypertension at E. Blair Warner in the midwife's centered care. 53% of the patients in the zip codes are classified as vulnerable from the CDC Social Vulnerability Index. With FISP, with our Family Infant Support Program, we have partnerships with Beacon Medical Group Practices, HealthLink, Nurse Family Partnership, and St. Joe County WIC, along with Women's Care Center. So for this funding opportunity that we're asking are how patients are identified through targeted outreach through BMG offices. And we're working primarily with 2 offices in BMG. They will look at the vulnerable zip codes in St. Joe County and with hypertension diagnosis. The patients are then screened. So patients will look at risk factors, including hypertension, and then all patients will be screened with SDOH, the social determinants, and will be sent to us according to those. The main social determinants that we will be looking at is transportation, just because a lot of these patients who have hypertension need to have frequent visits and they need to be seen through the physician offices. With that transportation barrier, they really don't have that ability to go in often to get their blood pressures checked. So that will be one of the SDOHs we really focus on during that. And then patients are connected to care. So when the patients are screened for SDOH, they have that diagnosis, they are then sent to our program. And they are sent through high risk, brought in through the program, and they connect to the FISP program. So what we have is a high risk OB nurse, who is Missy Ryder, who's here with me today. And what she will do is she will receive these referrals and she will additionally screen these patients. And along with Missy, they get the access to all of Family Infant Support programs. So they get the community health workers and they get everything that is offered through our normal program. So patients who choose to participate in their program will receive remote monitoring. So the remote monitoring is a wireless blood pressure machine that they are given to take home. The blood pressure machine is incredibly nice because it has a phone with it. So the phone is fantastic because it has its own SIM card. It has its own capability to where we can wirelessly talk to them. We can talk to them through the computer, the platform we have. We can also video chat. So not only can we do the blood pressure monitoring if a physician's office is concerned about the patient because their phone has been disconnected, we have that capability to video chat with those patients or text through that phone that comes with the app. They do not need to have the service comes with it. So that is an added benefit with the device. Not only blood pressure, we also have the accessibility to them. So our prenatal and post part of the proposed goal is to serve 136 patients. So with that 136 patients, the funding opportunity would come with the device and it would come with the platform. The platform is an extensive computer-based system where the nurse, when Missy is monitoring, the system will be up right in front of her. When the patient takes their blood pressure, within seconds, it is transferred to the platform. So we see immediately their blood pressure. Through that, we're able to get a hold of the patient quickly through video, through chat, through however we need to contact the patient. If they have a high reading, we can check on them and see how they're doing. We can say, how are you feeling? How is everything going? So what our plan is in February, we're going to start the program. We already have many physician offices who are waiting to send patients to us because this is a very big need for our patients. March, we're going to be scaling up enrollment, and then April will continue the growth in education. By May, we'll be maintaining capacity. How this works is they are monitored for 6 months, 3 months prenatal, 3 months postpartum. So once patients start to filter off, we can add more patients on. So we'll be continuously, when one graduates or 2 graduates, we'll be able to add more patients onto the remote monitoring. Then through June through September, we'll be doing an incremental expansion. So we'll be adding patients as other patients are dropping off. At no time will we turn down patients and say, your 6 months is up, you're no longer able to be monitored. If that need is there, we will continue to monitor those patients. So the program impact, the KPIs, is to provide 85% of the devices and the remote monitoring devices and FISP care coordination service, to improve adherence to hypertension protocol by 85%, to increase the percentage of patients achieving target blood pressures. And then our outcomes is to improve maternal health outcomes, improve infant health outcomes.
Very good.
Thank you. Thank you. Any questions?
Thank you very much. Any questions?
I just, as somebody who doesn't have a medical background specifically, how exactly does the blood pressure monitor work? So for the mom,
yes,
how is it kind of foolproof?
It is. So we actually brought it with us today to show you because we researched a lot at the different companies that had it. And this was the one that was most user-friendly and easy to work with. So when you put the blood pressure device on and you turn the phone on, it literally will give step-by-step to the patient how to position themselves, how to put the blood pressure cuff on, tells them when to push the button, tells them, even if it runs high, it instructs them to take a deep breath, relax, check again in 15 minutes. So it really does talk them through that. So they have those steps with the device, and then they also have the outreach to be able to reach Missy with any questions. But it shows pictures and it shows diagrams. There's pictures on the blood pressure machine. There's everything showing them exactly how to put it on, how to position themselves. So it is pretty foolproof.
Okay.
And we've had people try it. We got it as a demo, and I've had people try it. We've had patients test it just to make sure that it is something that's easy to be used.
Good.
That's great.
Yes.
But the fact that I'll be able to look at these people and see them from experience and being able to say, how do you feel? What are you doing with that blood pressure? Is this act we need to act on it to continue to trend and watch?
Very good.
And the patients will be monitored 24/7. That is something also, we will be there during the business hours, but we are able to program in the phone an automatic text response. So if a blood pressure does run high, if they feel symptomatic, they check their blood pressure at 3 a.m, we can program what the patient needs to do with that high response. And so we're able to really still communicate with them even when we're not actually in the office.
And then to be clear, you're targeting women who might have a higher risk of hypertension during pregnancy, but also have transportation barriers that might make it more difficult for them to get to the maybe more than regular prenatal appointment.
When they have hypertension, they need more frequent checks. And so they're not able to get to those frequent checks. So this kind of eliminates that barrier to where we're able to still check them in the comfort of their own home and have a nurse that's able to check on them, and a CHW that can run to the house and check on needs also.
Oh, that's great.
Ma'am, if you're gonna talk, you have to go to the microphone.
Very,
And it's,
very good.
yeah, what she was gonna say is it's really nice that she can say when there's any type of issues, she can say, you know what, you need to go to the hospital, you need to go to triage, you need to be seen. And then we can also send them to their provider also.
Oh, that's great.
Awesome.
That's awesome.
Thanks,
Thank you.
I appreciate it. Great. Next, we have E. Blair Warner Family Medicine Center. I believe Vicky is coming up. Yes. And I will be your clicker.
Hi, my name is Vicky Alber, and I'm the practice manager for E. Blair Warner Family Medicine. And I am seeking funding to support our prenatal education program. So who is E. Blair Warner? We are a full spectrum family medicine practice. We outpatient, inpatient, as well as obstetric care. We are also home to 30 family medicine residents, which Dr. Callahan talked about earlier, as well as 10 core faculty physicians that support those doctors. We serve about 12,000 patients a year. So we have a lot of people coming through our clinic. So the infant mortality rate, just to speak to that a little bit, we know is rising in St. Joe County, which is primarily the county in which we serve. E. Blair Warner is located directly across from Memorial Hospital. Click. So we know the FEMUR data shows us that in 2018, it was 6.9 to 1,000 live births. That was the infant mortality rate. And in 2021, it rose to 9.9. So how can we help combat that? St. Joe County is 1.5 times the state average and 1.8 times higher than, go ahead, you can click it, than the national average. So recommendations from infant mortality is to provide education on how to monitor fetal kicks within the 3rd trimester, increase knowledge of mental health medications that are safe to use during pregnancy and breastfeeding, and increase the knowledge of substance abuse disorders. Educate patients about THC use in pregnancy, and expand and personalize safe sleep education. Strengthen the mother's ability to recognize signs and symptoms that signal pregnancy complications and encourage that person to go ahead and seek care. So the KPIs for our education: develop a prenatal education program to improve maternal infant mortality for ROB patients that are cared for at E. Blair Warner. Improve E. Blair Warner patient attendance to prenatal classes by developing incentive-based education, which helps us take down some barriers for those who cannot come to the clinic. Utilize patient incentives again to increase engagement in expanded prenatal education that specifically addresses health risks known to contribute to high infant mortality. Click it. So about E. Blair Warner's OB patients quickly, we do about 425 OB intakes a year. We do 350 deliveries or so, all at Memorial Hospital. We make up about 15% of the overall deliveries. Our average maternal age is age 28 by the time they come to us, and we do serve a high population of need. We are 75% Medicaid. And 77% of the patients that present to us self-report that they have high-risk conditions. Those are depression, diabetes, intimate partner violence, sexual abuse, suicidal ideation. 40% of those also report more than one of those conditions. So historic prenatal classes at E. Blair Warner, we have offered classes in the past. They have been poorly attended. We have attributed that to lack of childcare, lack of transportation, and conflict with work schedules. So the grant request is to develop prenatal classes that include both routine prenatal education and expanded education. We want to offer incentives for attending in person, as historically, as I noted, they have been poorly attended. Provide electronic devices for patients that cannot attend in person that are preloaded with the curricula, or offer those the virtual option for people who can't make it, but they actually have Wi-Fi in their home. So the curriculum is becoming a mom, alcohol and pregnancy, drugs and pregnancy, count the kicks. We have pre-recorded educational videos that were done by our OB fellows that we want to put on the tablets. And then Parenting 101. We want to purchase 10 devices, and those will be tablets, not laptops. And then our incentives are gas cards, grocery cards, diapers, and then we want to do a raffle for expanded car seats for those people that show up. We want to put their name in a hat, if you will. And click. So our project timeline, January through March, we want to purchase our resources, develop the online content, train our staff, and identify the patients who enroll in the program, which we're hopeful that it's all of the OB patients that we get in our clinic. We want to, in April, start twice monthly our classes. And then June through September, we will complete our course evaluation and outcomes assessment, develop any plans if we need to change anything. And then, of course, in December, we'll finalize the project and do an evaluation and see what we've learned. Thank you. Any questions?
Very good. Thank you. Any questions?
I'm the one who has the microphone that's not working, which is ironic.
Yeah.
I'm curious, I guess to be clear, where exactly, oh, thank you. Where exactly will the classes be located? Will you try to spread them throughout the community?
We hope to host them at E. Blair Warner. One of the things that we found is that if we need to keep our patients in our house, right? They're confident there, they're comfortable there, and we'll do the outreach via the web. Because we will link them in on these devices if we can.
And are these classes are then free to
They are free.
anyone, or
currently we are going to serve E. Blair Warner patients.
Okay.
We have our own infant mortality and we really want to touch those people. The other thing to note as well is that 60% of the patients in which we serve what we categorize as OB only patients. So those are patients that come to us that are not our continuity patients. We know little about those folks. So while we may not be outreaching to some of the other clinics, we are serving patients that don't have a primary care provider. So.
Thank you.
Thank you.
Awesome. Thank you, Becky.
Okay, next we have Heidi Pollard from the Northern Indiana Maternal and Child Health Network.
Good evening. I'm Heidi Pollard. I'm the Executive Director of NIMCHN, Northern Indiana Maternal and Child Health Network. And we are proposing to do the Reproductive Health Education and Access Program. A little bit about us, just to kind of get started. Our mission at NIMCHN is to provide confidential, respectable, and affordable reproductive health care to residents in Northern Indiana, regardless of gender, race, age, sexual preference, or income. Go ahead. And then we reached that, to reach that mission here, we focus on these goals: improving the health of women, children, and families in our region, lowering the incidence of unintended pregnancies in our region, and lowering the rates of sexually transmitted diseases in our region. NIMCHN houses 2 different programs for our organization. And it's through our disease intervention program and our reproductive health program. And we operate 4 clinics throughout Northern Indiana: Mishawaka, Elkhart, Warsaw, and Valparaiso. We are respected and in the community, and we have a reliable and longstanding relationship with our community providers. We've been in St. Joe County since 2005. And we see approximately 3,000 unduplicated patients every year that come into our clinics. Another thing that's unique about our organization is although we are able to accept and bill insurance, all of our patients are put on a sliding fee scale that determines responsibility for their payment. No patient is ever turned away regardless of their ability to pay. And if a patient is unable to pay, even if they have an amount that they would have to pay, their bill will be written off and they'll be never turned into collection, and we will always be able to see them no matter what. And we are able to see undocumented, well, you don't have to have proof of residency to be seen at any of our clinics. So on to, I think, Robin already went through it, but we are under the core service area of maternal and child health. And we are determined to reach both the mandated key performance indicators that have already been discussed prior here too. So our project is with the community, the Reproductive Health Education and Access Program it's a multifaceted approach to reproductive outreach and access and education through community outreach and education, through provider outreach, and through offsite reproductive health services. We aim to provide St. Joe County residents facing barriers to receiving reproductive health care the resources to obtain services through means of community health workers and nurses delivering education, working with established clinics to provide reproductive health services, and either on-site, off-site, or via means of telehealth. Okay. Oh, sorry. No, you're good. Sorry.
Okay.
So for the first part here with our community health and our community outreach and collaboration, we will be hiring a community health worker, which we're identifying as a communication and health promotion specialist. And this person will be from the community in which they're going to be serving, and they'll receive intensive training to become certified, allowing them to be reimbursable through Medicaid for their services. This helps with sustainability. And this position is also going to work with established community health workers within St. Joe County, along with the St. Joe County Department of Health, to provide any extra training that they receive and that knowledge to other community health workers in our areas. So that helps with collaboration and, again, helping with sustainability when it comes to prolonging this program after the funds have run out through this grant right here. NIMCHN has a close relationship with area community services already, such as WIC, Healthy Families, Health Plus Indiana, Babe Store, St. Joe County Department of Health, as well as we participate in coalitions such as the FEMUR, Healthy Babies, and the ZIP Coalition. And so this allows easy access to educate both the community members about our services, as well as give presentations to patients throughout the county. Our next area that we would do is provider outreach. And so this tells you right here a little bit about the providers are an excellent source of outreach in our communities. A lot of times our patients are going to their primary care providers, to the local urgent cares, to their OBGYNs or their urgent cares, and they're looking for reproductive and or sexual health services that they can't, sometimes the providers aren't able to offer, or they're not able to receive due to cost or even agency policy. And so what we can do is we go out to our providers and let them know about services that are in the area, including our clinics, that we can help them out. So we can help do some of the services that they may not be able to do. And different reasons why, because you have patients that are going to these providers and they've already, maybe they've been going to this provider in the community and they lost their insurance, or they have a high deductible plan, or they have a balance due, or, and so this allows the provider somewhere to go to and say, you know what, this is a reliable place in the community you can go to, and we work with them, and you can get services, and you can still come back here, and we can work hand in hand with those providers to help make sure that our patients are getting reproductive health services that they need. Because again, healthy pregnancies and healthy child spacing is going to equal healthy babies in our county.
That's great. Any wrap up comments for us, please?
So. And I don't have anything other than, I have a timeline in here, but I think if you just want to, if anybody has any questions or, yep, I kind of going through our timeline, just letting you know what we'll be hiring workers, doing training, we'll be doing ongoing evaluation, and then working, identifying agencies in our community that we already work with, just to do more outreach and education to them, and offer offsite services through means of telehealth.
Very good.
Great. So.
Thank you. Any questions?
Do you offer like broader fertility awareness services?
We absolutely do. So yes, so part of our core services is we are able to offer different types of family planning. And so we can, it depends on, it's really client led. So if patients are coming in and let's say that they're having problems getting pregnant, we are able to offer basic infertility services, really talking with them about their bodies, helping them learn, how to get pregnant. It's not as easy as some people, think. And so we can actually sit down and do education sessions with them in order to help them. Also, another thing that's really unique is that if somebody's coming into the clinic, they're talking about maybe possibly getting pregnant in the future. Not really sure when, but maybe in 6 to 12 months, we're going to start that patient off on folic acid immediately. So again, we're preparing that body with have a healthy pregnancy. We're also going to do preconception counseling with them to make sure that they understand and we can identify those risk factors. A lot of our patients don't have primary care providers. We can link them up with that, but truth be told, they don't have insurance. They're not going to get it till they're pregnant. So they're going to keep coming to us. So we can identify those high risk factors that help or that can cause increased infant mortality and maternal mortalities. And we're identifying those at our visits and we're watching them and they keep coming back to us so we can help keep an eye on that for them.
Awesome. Any other questions or comments? Thank you very much.
Thank you.
Heidi. Next, we have Joyce Adams from University of Notre Dame.
Will you be my clicker?
I'm not great at it, but I'm trying.
Bar 19. All right. Good evening. My name is Joyce Adams, and I'm representing the Eck Institute for Global Health at the University of Notre Dame. And the core service area that I'm presenting on is maternal and child health. We Most of us in this room are probably aware of the high maternal and infant mortality in our state and also in our county. And I had prepared, a lot of data to present, but since the presenters from Beacon Health and Blair Warner have already gone through those statistics, I will not repeat them. But then access to quality care before, during, and after childbirth is important. And when we look at the AFIMA Maternal Mortality Review Committee data, 15% of pregnancy-associated deaths in women occurred among women who did not receive any prenatal care, and additional 22% occurred in women who received prenatal care in the second trimester. The postpartum period is also very important if we want to improve outcomes. 83% of pregnancy-associated deaths occurred during the postpartum period from the Maternal Mortality Review Committee report, including 60% of these deaths occurring after 6 weeks after delivery. So in addition to all of that, we know that women in our county experience several barriers to care and access to resources. They talk about not being able to access resources, although we have a lot of resources in our communities. And they also talk about needing more educational programs, more access to prenatal and postpartum appointments. And given all of the above motivating concerns, we are proposing to establish a trusted, consistent one-stop shop for mothers and families to access resources and support during pregnancy and the postpartum period in one convenient location. We are calling this one-stop shop Pop-up Pregnancy and Family Villages. So our Pop-up Pregnancy and Family Villages will transform the delivery of health services by creating this one place, one convenient location where existing evidence-based programs that are currently operating in our county can come together to for women to be able to access those resources. Who and where? We are targeting all pregnant and postpartum women in St. Joseph County. But in terms of the location where these pop-up villages would be set up, we are targeting South Bend and Mishawaka communities. The reasons being that looking at the FEMA data from the health department, most of the high infant mortality zip codes are located in South Bend and Mishawaka. So we'll plan to hold a pop-up village in South Bend and a pop-up village in Mishawaka, but these pop-up villages are open to everybody who resides in St. Joseph County. What will the pop-up villages look like? It will be a one-stop shop that would provide various services, and I'm including some examples on the slide. Insurance navigation, we know that a lot of people have difficulty navigating insurance or are unable to access care due to insurance issues. Connections to medical care. So for example, we could have, Health Link on site to be able to connect people to medical care if they do not already have one established. Health screenings, such as blood pressure screenings, mental health screenings, and education on various topics, safe sleep, smoking cessation, postpartum educations, prenatal complications, etc. Connection to already established social service programs that we have in our county. Examples would include WIC, the Women's Care Center, Nurse Family Partnerships, and even some of the various presentations that you've heard on different programs. Assistance with social drivers of health, and also just general community building and celebration and wellness. This would not happen if we are not collaborating with all of the existing programs that we have. So this is going to happen through collaboration and long-term partnerships with what we are calling vendors, partners, and sponsors. So partners would be organizations that would want to come together to work with us to plan these pop-up villages and make sure that they are running smoothly. And then we'll have various organizations as vendors at the pop-up villages who are providing services and resources to women and their families who show up. Next slide. Okay. So the state KPIs that we are targeting, as you are aware, is up on the slide. When you look at the first one, identify opportunities to improve birth outcomes and implementation of an evidence-based or promising program. That is exactly what we are doing. This is a program that we are trying to implement with the goal of improving birth outcomes in our county. And we have plans to have like, refer families to needed services, including, everything that's mentioned in that KPI at the state level. We've also come up with program-specific KPIs that would help us to achieve those state KPIs listed, including tracking and reporting referrals to community resources and enrollment, tracking and reporting vendor and community organization participation, and coming up with a process to evaluate short-term outcomes as well as long-term outcomes, such as, prenatal care appointments, postpartum care, birth weight, etc. So for our timeline, from between February and June is mostly going to be planning, creating a shared vision among all organizations, what the structure and nature of the pop-up villages. And then in June, we'll spend time developing awareness materials and spreading that awareness about the pop-up villages across county. We plan to have our first implementation in August in one of the 2 locations. And in the beginning of September, try to do like some process evaluation. How did it go? What do we need to change? And then have the second site implementation at the end of September. Between September and November would be impact evaluation. So looking at all of the outcomes and whether we're able to achieve them or not. And we do realize that, we have certain reports due at certain time points. So we have them in our timeline as well. So when we think about impact, what we are really trying to do is decrease barriers to accessing care. We have so many resources in the county, but women just have a hard time accessing those resources. Most of our services are offered Monday to Friday during working hours, and people are either at work or taking care of their families. So having that one convenient location that's offered, say on a weekend, on a monthly basis, that people can just come and be able to access it will really help to decrease some of those access barriers. And also we've already talked about some of the outcomes that we want to improve, and also just, bringing together community organizations in a more comprehensive way. So, I can already see how most of the presentations that we've had today, like Health Link, Street Care, just to mention a few, can be part of these pop-up villages to be able to provide the services that they already have. The cooking classes, for example.
Wonderful, very interesting. Any questions or comments? Go on.
I guess I'm trying to envision this in my mind, like for a woman or family going to a pop-up village, like what would they see? Would it be a lot of vendors, community partners who are kind of marketing, advertising their services? Would it be classes? Would it be talks? I mean, what would the woman going in experience?
Yeah, that's a great question. So one of the things, the distinctive things about this program is that we're not just there to have, different organizations and vendors come and say, this is what we do, this is what we can provide, use our services and not their services. This is a place where, they are committed to actually providing those services to women. So we would have various stations. So for example, one station can be on insurance navigation. We can have another station on connection to medical care. And so if somebody comes and they don't have a prenatal care provider, right? If they go to the station on connection to medical care, we have people there who can be able to look at, okay, what insurance do you have? Where do you live? And actually be able to help them find a provider that they can get an appointment with on site. So it will, just imagine a large space that has all of these different, key services that women need to have healthy pregnancies and birth outcomes. And then they can, depending on what their needs are, go to various stations and get the help that they need on site.
So when you pick your spot, how long will you be there with the village? How long will the village be there?
So for this first year, with the planning and pilot implementation, we'll do one in each location. And then beginning in 2025, the hope is that this will be a monthly community event. So if we say, the last Saturday of every month, women in the community knows that, if I come to, Mishawaka on the last Saturday of every month between 1 to 5, that, these services are available for me to access.
So will it be like one day? Like
One day, yes.
Yeah, okay.
And so that's why we are calling it pop-up. It pops up and then disappears until the next month.
Okay, great.
So basically what you're saying is these are kind of the pilot part of this, like the pilot part of the project. And then what you're hoping is that like in 2025, once a month, you can go to Mishawaka Public Library or La Casa or someplace, and from 1 to 4 on a Sunday, and you'll know that there are going to be all of these services there that will allow you to get help with pregnancy and family issues.
Yes.
Okay.
Because this is something, a program that's new, hasn't been done in our community before. So we need, that, February to June time period to really plan this, partner with all of these organizations, create that shared vision, and then, implement it towards the end of the year. But then we do want to take, November, December to look at the first 2 implementations to really assess, did we achieve what we wanted to, so that we can then, if there are any changes that we need to make, be able to make those changes going forward before it becomes a monthly event.
Great. Thank you very much.
Thank you.
Thanks, Joyce. I appreciate it. Next, our last presentation under the Maternal and Child Health Core Public Health Service is Women's Care Center, Emily Rose.
Good evening. My name is Emily Rose. I'm the Outreach Director for the Women's Care Center. Thank you so much for inviting me this evening. I am so honored and grateful to be here with you all today. So what we are seeking funding for is our new care program to address the need for better prenatal and maternal care to help reduce infant mortality rate and improve maternal outcomes as well. So our centers here have had an incredible year of growth. Nearly 3,500 unique women walked through our doors this past year, most of whom come from at-risk and minority backgrounds and populations. So you may already know that Women's Care Center is the first stop for every other baby born in St. Joe County. And although there are many wonderful services in this area and in this community, it is clear that there is an increased need for quality and early maternal and prenatal health care for those who can't or don't know how to access it, to both reduce those infant mortality rates and improve maternal outcomes. So our unique access to pregnant women and young families is one of the things that makes Women's Care Center special. It gives us the opportunity to help women have healthier babies and build nurturing and self-sufficient families. And the St. Joe County Department of Health can help us do this. Historically, women have come to our centers at least 3 times during their pregnancy, once per trimester, but ensuring continuous care is so important, and this is what you can help us achieve. So we have noted that with every visit a pregnant woman makes to our centers, her baby's birth weight increases by 1 to 2 ounces. Women who have made 3 visits had babies with an average birth weight of 6 pounds, 15 ounces, and women who made 7 visits or more had babies with an average birth weight of 7 pounds, 5 ounces. So because of this observation and to increase the number of women accessing prenatal care on a timely basis, receiving prenatal vitamins and participating in healthy baby, healthy pregnancy education, we have created a new one-on-one care program. This program would begin right away, basically for the timeline. We're ready to roll it out. It would take about a month, maybe 2, to print all the publications for it, but everything else is already ready to go. So could you switch to the next slide? Thanks. So when a newly pregnant mom enrolls in our care program, it will ensure that in addition to her 3 visits that she makes during each trimester, she'll have an extra visit per trimester, including one during the ever critical 4th trimester after the baby is born. Because every woman is unique that we see, the care program can be customized to each individual woman's circumstances and needs. The visits begin with addressing and solving challenges to accessing prenatal care, insurance, and social needs. They continue through making a birth plan, choosing a childcare provider, safe sleep education, and then including a free crib and pack and play, and then car seat safety information and education. And we also give them a free car seat and installation for that as well. During that final 7th visit after baby is born, mom will meet again with her counselor to check in. The counselor will both assess and teach her to recognize the warning signs of postpartum depression through both conversation and administration of the Edinburgh assessment. We will provide her with any resources necessary to ensure her well-being, and we will offer additional group classes that specifically address the postpartum period right in our center where she's already comfortable. So most importantly, and to summarize, because we have the opportunity to walk with a new mom for every step of the pregnancy journey, building that relationship of trust, we want her to know that she is not alone. And healthier moms have healthier babies. That is what we have found. We have so much data to support it. And it's our job to ensure that the moms in St. Joe County have access to the care and support that they need. But we can't do this alone. So Women's Care Center services are 100% free of charge to the women we see. Our centers here are also entirely privately funded, and almost 90% of those funds go directly to the moms in St. Joe County. So to more than double the number of visits that we provide each mom and to produce the necessary publications, our costs will increase dramatically. We know that, though, together, we could make an incredible difference. And we know that we will see decreased infant mortality rates in our county, as well as improved maternal well-being. So last slide, yes. Thank you for this opportunity to be with you today. Together, we will continue the significant progress to put health first, to get more St. Joseph County children on the right path right from the start by being exactly where it matters most with the mom.
Great, thank you very much. Any questions or comments?
So the health visits that you're envisioning, are they conducted at the Women's Care Center locations?
Yes, everything that I just described happens right in the same center. So she will go there as soon as she suspects she's pregnant. She'll have her pregnancy test right there. She will go to the same counselor and sit in the exact same center all the way throughout the duration of her pregnancy and postpartum visits.
And that's part of what I was wondering too.
Mhm.
Will most of these be working with her same counselor, or will there also be for certain visits, other individuals who might who will come in and help her with? I know the community health workers, I guess, already do some of this. With
We do
insurance
have-
navigation and things like that.
Right. So the program leads who we have identified to basically run this program will be the ones who are seeing the women who enroll in this care program, which means that, yes, they will see the same person every single time.
Okay.
Thank you very much.
Consistency is helpful with them.
Yes.
That's what we've found. So thank you.
Okay, thank you. Moving to our core public health service, school wellness. We have Jim Conklin from Cultivate Food Rescue.
Hi, I'm not Jim. I'm actually, no worries.
My bad.
Annie Holland, Director of Planning and Programs with Cultivate. Jim is here as well, in the audience. You can go to the next slide.
Oh, that's my job. No worries. I lost my sweet.
So Cultivate is a nonprofit food rescue organization in South Bend. We focus on fighting food insecurity and food waste. And today we're going to be discussing funding for our backpack program. So our core public service area, school wellness, and the KPIs that Cultivate proposed for this grant is to grow to serve an additional 100 students in St. Joseph County through our partnerships with local schools and service organizations, and to additionally partner with youth serving organizations to further understand the impact of our current programs and also identify future needs. So the reason that our backpack program is so important is that there are 13,000 children living in poverty in St. Joseph County and an additional number of students who are on free reduced lunch at our many schools. So our backpack program fills the 68-hour gap between lunch at school on Friday and breakfast on Monday for students who are food insecure and on free reduced lunch as well. So these students are identified by school social workers, nutrition directors, and are sent home every weekend with 6 nutritious frozen meals to eat over the weekend. So all of this food is prepared by volunteers and we use rescued food resources for all of these meals. So we try to focus on lower sodium, lower sugar type of meals that can be easily heated up in a microwave by children. We are currently serving 1,350 students across our 3-county service area, and 570 of these are in St. Joseph County. So for this grant, as I mentioned, we are proposing to support an additional 100 students in St. Joseph County. We have a long waiting list of people interested in the backpack program, and many of our current partners want to expand as well, but we have to continue to grow our food resources, volunteers, and financial resources at the same time in order to sustain our growth. These are just some of our current meal partners. So South Bend Schools, Career Academy, and most recently Paramount and Grissom Middle School are our school partners, and then some additional partners that serve meals in the community. Mishawaka Schools has already expressed interest in joining the program, and Penn Schools would like to expand, as well as a few private schools in the area.
It was working so well.
So the timeline for our program, we are actually hopeful to start with E. Blair Warner in January or February, whenever the funding is allocated. But then we do evaluate our capacity to grow this program every semester and summer. So for the 24-25 school year, we hope to be able to expand to even more schools and locations in the community. We are currently distributing around 4,500 meals a week with St. Joseph County partners, and our volunteers are producing over 8,000 meals every week, and we're often distributing more. So again, the inventory levels is kind of how we evaluate when we can add partners, but we are growing to a new facility right now if you drive by our building, and hope to also expand and get a new volunteer location in Elkhart County so that we can grow our program to over 10,000 students in the next 10 years. So the impact of this program, in addition to the nutritional benefits of a frozen meal over the weekend for students who are food insecure, there's also a mental health and a developmental benefit for students. It's hard to show up to school ready to learn, focused to perform well in the classroom when all you're thinking about is being hungry. So we actually were able to partner with the Lucy Institute at Notre Dame this past year to survey families about the impact of the program on their overall well-being, including financial, educational, developmental. And we hope to continue to grow current partnerships, add new partners, and also increase communication with school staff and social workers to help identify more needs for these students and also improve the efficiency of our programs. Again, we hope to collect data. We have actually been talking with a resident at E. Blair Warner as well, who's interested in researching with some of their clients the impact of these meals on overall health of their clients. And then to finish, these are just a few testimonials from families who have students in the program. Again, the need is really great for these meals in our community. And so Cultivate is hopeful to partner with you all to continue to grow our impact and feed more food insecure members in our community.
Great, thank you very much. Any questions?
So I have one question. What happens, what do you do with kids who don't have access to a reliable freezer or a reliable microwave? How do you address that issue?
Yeah, so some of them have support at the school, so maybe they can store them or come eat them at different times during the week. If it's at school or at home over the weekend, we haven't been able to exactly address that problem, but that's also part of the reason that we're expanding into different types of partnerships with the library, with Clay Pantry, and other public locations that actually have freezers and microwaves on site so that people can come there and heat up the meals.
Do you, I know it's probably harder to get as well balanced a meal, but are there options for like sandwiches to take home over the weekend or things?
So all of our meals come in the same packages, but we do have a variety of breakfast meals and like lunch, dinner. So every day we have a new menu. And so when the students go home with 6 bags or their bag of 6 meals, it should be 6 different meals. So then if there's allergies or just preferences, then students can kind of sort through those and also just share with family members.
Any other questions? Thank you.
Thank you.
Awesome. Thank you. Next we have Lisa Kelly with Mental Health Awareness of Michiana.
Hello. I will start talking and hope that the slides magically appear. So I'm Lisa Kelly. I'm Executive Director of Mental Health Awareness in Michiana. We're a relatively new organization in the community. We've been around for 5 years, and we're an affiliate of Mental Health America. Our mission is to improve the quality of life for those who have mental illness or mental health concerns in Michiana. So our catchment area is St. Joseph County and Elkhart County. Our belief is that good mental health is a critical part of overall wellness. Next slide. And our initiatives, we do classes and events in the community and we also do access to care initiatives. And our initiatives really aim to eliminate stigma and promote wellness, build collaboration in the community, and remove barriers to care. So all of our programming really falls into those categories. In 2023, we reached over 600 individuals with our public education classes. And that was about 4 times the number that we reached in 2022. And we've been invited in 2023 into Concord High School and one of the local middle schools in St. Joseph County. So we know that there's an interest in what we're providing in terms of basic public information, public education about mental health, mental wellness, tools that people can use to improve their well-being. What we learned from because we had not adapted our presentations to children, we were doing the same presentations to adults and to the high school and middle schoolers. And what we realized is that we really needed to adapt the presentations to make them more accessible and interactive. And so this past fall, we had some Notre Dame undergraduate interns who worked with us on developing those into more youth-friendly presentations. So we just finished adapting them. Our approach is really to think about stigma as hindering open discussions about well-being, and that youth can encounter obstacles and misinformation regarding mental health. The vast majority of youth get information through online sources. And so what we are hoping to do is provide good information in a school setting. Can you do the next one? So our goals, we're under the school wellness area, and our goals are to foster an understanding of brain health, mental wellness, and relationship dynamics in a youth-friendly context, and to enhance skill development with the students, equipping them to navigate challenging situations. And we also want to be able to provide resources that students can access and share with their parents and trusted adults. So there's 2 classes that we've adapted for youth. The first one is Understanding Mental Health and Wellness, and it's introducing very basic concepts on brain health, emotional well-being. We do talk about some common emotional issues, and we also provide, encouraging actionable strategies to promote wellness. So that's one presentation, and the other is Healthy Relationships, which talks about characteristics of healthy relationships, describes unhealthy relationships, and explores boundaries and effective communication strategies. So those have been those two classes for adults have been the 2 most frequently requested classes. And we feel like they're the easiest to adapt to youth population. Our goal is to offer 10 to 12 classes to middle schools and high schools in St. Joseph County, and to reach a total of 250 students. These are delivered by master's level presenters, masters in social work, masters in counseling presenters. And at the conclusion of each class, we do a survey. So we evaluate everything that we do because we want to learn what we need to do differently. So just in terms of what we evaluate, and the kids will be very honest with us. So we ask, how well did we meet our learning objectives? If there was new learning for them, how effective the speakers were, whether the presentation was culturally inclusive, whether they learned about new resources, and if they would recommend the class to friends or family. So our timeline, we have already adapted the presentations to a younger audience. And so January and February would be our preparation phase, where we'd be training our presenters on the new presentations. and prepare outreach and marketing and start doing outreach to local middle schools and high schools. And then we want to do a pilot phase, which is March to May, where we would do 3 to 5 classes and collect class evaluations. And then during the summertime, analyze the results, incorporate changes, and then train our presenters on any changes that we've made. And then actually reach more people in the fall. So it's more outreach and hopefully, what we would see during the pilot phase is that we have more people requesting the classes than 3 to 5 in the spring. But, even Concord High School and Holy Family that requested our class, they requested us to come back in the spring and in the fall. So we think that we have a good quality product, and the schools hopefully will talk about what we're doing. Could you go back a second?
Yeah, I think it went backwards. If you had some wrap-up
Oops.
comments.
Oh, sorry. Okay.
You're on.
So anyway, so our goal is to hopefully give kids some language to talk about mental health and wellness, and to give them some strategies that they can incorporate, and to give them good information.
Great stuff. Any questions?
Thanks, Lisa. I guess I'm just curious, right now, what are the specific mental health challenges that you're seeing among middle and high school students that are the most prevalent right now?
So relationship, so there's mental health screenings that are done through Mental Health America, and we get all of that information. It's all, none of it is specific to, identifiable people.
Yeah.
But we know that loneliness and relationship problems, isolation are the main drivers of mental health problems with young people. So the relationship problems, the class that we do on relationships, it really is to help people understand, that it's okay to ask to be treated well, and it's okay to communicate, with their peers when they're not being treated well. So the relationship problems, we feel like we can offer some basic skills, to help get them in a better space. Loneliness and isolation is a tough one because we can't really make them not, in that space, but we can offer them some tips on if they're feeling sad or if they're feeling lonely, that, reaching out to a trusted adult to talk, or, to invite friends, to get together and do things. So much of their world is online. And I think that we're trying to promote a message that we really need to get people outside. We need to get people talking to each other and interacting with each other. We have to honor the fact that they do communicate online with each other, but there has to be some other messaging to promote wellness.
Great. Yep. Thank you very much.
Okay, thank you so much.
Okay, next, we have Purdue Extension, St. Joseph County has a presenter from their potential pilot program site who will be presenting, since the Purdue Extension is at a mandatory work conference.
Wait a minute. Are you wearing a Notre Dame shirt?
I do happen to be wearing a Notre Dame
Okay.
shirt. Yes, I have a niece that's going there.
I'm a Purdue grad, so.
Oh, well, hey, it's all good. So my niece, her best friend is at Purdue. It's all good. It's all good. My husband went there. All right. Hi. I feel like I need a brain break. Oh, okay. I'm Regina Williams Preston, and I'm here with Charles Jamerson. As she mentioned, we are community partners working with the wonderful people at Purdue Extension. And we're presenting tonight on behalf of Emily Evers. She is the agricultural and natural resource educator. As you know, their team is presenting out of town. So that's what partners do. We step up, and we're here to take this grant over the goal line. So what a gift it has been tonight. And when I looked at the list, I was like, oh my God, we're like third from the last. But it's been awesome because to hear all the great work that's happening in St. Joe County, and everybody here is a potential partner. So that's fantastic too.
So many things that connect with us. So many things that connects with what we're doing too. So
yeah. So these proposals we've heard tonight connect with various community members. We've got real services with seniors. We've got St. Margaret's House with women, mothers and babies and homeless. And we're here tonight to talk about a unique opportunity where we're going to engage young people in the work of community wellness as a captured audience. We're going to go directly to the schools.
yeah. And then first and foremost, we're going to talk about the core public health service area where school wellness, health, wellness programming. First and foremost, every school that participates in the National School Lunch Program is required by law to create and implement a local school wellness policy. The benefits of that policy is going to be first and foremost that it's going to promote student wellness, creates a healthy environment for which kids to learn. And then that policy is going to be reviewed and updated annually by a wellness committee, and that committee is going to consist of parents, the school staff, and the community partners. Can we do the next one? KPI, partnership schools based on community need to implement wellness policies and comprehensive strategies to promote student health. Our goals by December 2024 will be 100 students at Coquilla our elementary school will participate in this junior master gardening program. And it is a junior master gardening program. It initially started out as just for adults, but Purdue decided to break it down and bring it to a more respectable place to where kids can begin to get in on this, because as we heard earlier, a lot of the problems that's happening with adults happen because they're just not finding out some of these things. So if we start the kids to learning it early, we think that a lot of that could be prevented. Secondly, the students who participate in the Junior Master Program will increase their preference for vegetables by 10%. And we'll figure that out through surveys, pre and post surveys. And Coquilla Elementary will also have at least 2 farm to school goals in the school wellness policy. And then the Learn, Grow, Eat, and Go national curriculum. That's going to be a 10-week unit of study that's going to be done in 2 different classrooms at the same time. It's going to create hands-on, multifaceted, academically rich, activities, recipes, and bilingual resources will be sent home weekly with students to share with their families. We're going to have indoor greenhouse, opportunity for gardening year-round. Outdoor gardens are harder to maintain at schools during summer times for obvious reasons. The kids are not there. But there's most importantly, it's hard to do water and things of that nature during the summer when the garden is at the school. And then finally, farm to school field trips. Students will learn about the job in agriculture, and then students can see where their food is actually coming from. Next slide.
So the curriculum is really about learn, grow, eat, and go. So they're going to learn in those captured classrooms 2 times a week for 10 weeks. They're going to actually have a chance to learn about plants. Then they're going to grow their own plants, right? So they will plant them, maintain, and then harvest. Once they harvest, they're going to eat them and see how awesome fresh food tastes. And we're going to make the connection between how we feel when we eat well and how we have more energy to go, go, go. All right, next. All right, so again, we said there's 20 sessions because it's twice a week for 10 weeks. We're going to have actually 2 sessions, one in the spring from February to May. And then we're going to, in May, we'll do the farm trip. And then we'll do it again. We'll pick it up. We're targeting 4th graders. And so we'll, again, in the fall, from August to December with some more field trips. Again, we're promoting healthy habits starting early to engage folks, and we're going to help them increase their awareness of local food systems. How do we connect with the people around us in the community that's doing this healthy work? They're right there.
Yeah, that's wonderful. Thank you. Any questions?
They used to be right there.
I guess just, now this pilot program, it says is going to be at Coquillard?
Yes.
Okay, and where, I'm just curious, where's your garden going to be?
Actually in the classrooms. So
Okay.
we're, part of the grant funding is going to, there was a picture up there of some hydroponic type stuff. And so it can be right in the classroom so they can watch their food grow and then harvest it and eat it right there.
Okay, and it solves the problem of trying to do this in February.
Right.
Exactly,
Right.
exactly.
Winter or summer, so it can be year round.
Okay.
That's great. Thank you very much.
All right, thank you.
Next is Ryan Yezel from South Bend Empowerment Zone.
Thanks, Robin. Hey, everybody. Yeah, my name is Ryan and I am the Director of Partnership Development for the South Bend Empowerment Zone Schools. We are launching the Post-Pandemic Wellness Intervention Project, which is a mouthful. Starting off just a little bit, I want to bring clarity and help you get to know the zone a little bit because there's a lot of questions I field about who we are and why we exist. So, yeah, I'm talking fast, Robin. I'm sorry.
okay.
There we go.
I
All
love
right.
it.
So we are 5 South Bend community schools, 5 public schools on the historically disinvested west side of South Bend. I have the asterisk there because sadly at the end of the year, Warren School will cease to continue as a part of South Bend Schools reorganization. Yes, thank you. So we have those schools. We were formed together in 2019 as an intervention due to historic challenges in school performance, and we will continue to exist for 2 more years past this one. So we have just a few more years to try and get our schools and our families caught up to speed before we hand them back to the school corp as a whole. We represent 1,800 students and their families. As you can see, a high percentage of free and reduced lunch and English language learners and special education needs. And we are 39% Black, 39% Hispanic, 14% white, and 8% other. I like to say that schools are the front door of community social services because we are educators at its core, but yet so more than that. As challenges show up in our community, they often show up first in our schools. So our teachers, our staff are the ones first coming across food insecurity, housing insecurity, insect infestations, lead poisoning, community trauma. They all often show up at the hands of our teachers and staff first and foremost. On top of all that, as we know, March 2020, in addition to all those other things, we hit the global pandemic, which not only inflicted harm on our students, producing adverse childhood experiences, whether that will end up with capital letters throughout that or lowercase, it's experiences that were trauma-inducing for our children. In addition to the trauma they face as a result of the pandemic, it also delayed wellness growth because they missed critical years of time in social interactions and also the strategies that are taught in school, meaning that our students are behind. As you can see from the stats, 87% was the response of public schools saying the pandemic has hurt the social emotional development of their students, and 84% says their behavioral development has been stunted as a result of the pandemic. So we have some work to do. So our project is student health, as you would expect. And here are key performance indicators. Obviously, we are deepening school community wellness partners. In all aspects of this, we are trying to work with our partners. With the zone deeply believes the strength that our schools need is already here in the community. So we want to work together. Anybody still here in the room? If you haven't already, the door is open for partnerships with the zone. I'd love to talk to you. Beyond that, we are doing social emotional wellness interventions and building strategies for social emotional wellness moving forward. Our 3 priorities, this got bounced around a little bit. Gentlemen Scholars. So Gentlemen Scholars is a group of 3 Black men that come into our classroom specifically with a heart to work with Black and brown children and children who have dealt with social trauma and disinvestment in their communities. So they help with social emotional interventions and skill development, building life skills among our students that are specifically selected by our social workers for intervention needs. So those guys will be in working with classes of 30 students twice a week across each of our remaining zone schools, as well as doing lunchtime mentoring sessions with them. Second is a TBRI, which is trauma-informed strategies for self-regulation that will be taught by Village to Village International, which is the group behind the Oasis community of students aging out of foster care. So they will help us by training our staff, and then our staff will also be working with our students. So the students will gain the strategies and our teachers will gain the strategies for implementing regulation techniques in the classroom. And then finally, social worker supplies for our social workers, and those will be for sensory needs and for skill building for social emotional skills and interventions.
Sorry.
Yep. Our timeline, and again, apologies for the formatting on the PowerPoint here. Our timelining, if this goes through in January, we'll start right away. We're going to conduct a survey at the beginning and the end. So that will launch Gentlemen Scholars. We're ready to go in across all 4 of our remaining zone schools. They've already been in Coquillard as a pilot program, so we're excited to expand that throughout. And right away, we'll be able to purchase those social worker supplies. And then in the summer, in our back to school training, we will do the staff training for TBRI and launch that across our schools in the fall. Impact, we're excited for new and deepened school community partnerships with 2 South Bend public health organizations and Gentlemen Scholars and Village to Village. Our teachers and staff are going to lead with strategies and the ability to implement trauma-informed approaches to student interventions. You're good. And students will lead with increased social emotional skills, such as self-regulation techniques. All of this wellness will result in increased school attendance, decreased chronic absenteeism, which is a category of school attendance that has great correlation to increased challenges as an adult. The need for decreased behavioral interventions and increased academic achievement. As a whole, basically, we got to get our kids caught up. And so as we talk about what does it look like to sustain this, the schools have sustainable models in it. We have social workers, we have counselors in our schools, but the pandemic just kicked us to the point that the need is too high for the normal systems to be able to handle that. So we need to get everything caught up so the normal systems can sustain things moving forward. Thank you.
Thank you very much. Any questions or comments?
I guess I have 2 questions, but probably the most important one is is there any outreach to parents incorporated into this, or how are parents brought into some of these programs?
Yeah, we need to do that is the answer to that. The kids will be walking away with the techniques that they can manage at home, and we would like to make whatever those strategies that the teachers are learning, we would like to make sure that can go home with them as well. I know Village to Village has packets of information for the broader family to know. I was a foster parent, and the training that I received as a parent, maintained our sanity and helped us to relate to our daughter well. So I know how useful that could be at home.
And can I ask my other question? Sure. I'm just curious, with the Gentlemen and Scholars program implemented in the school, is there kind of a certain age range you're targeting? Is it going to be like middle elementary? I guess Navarre,
later elementary, so more 3rd through 5th graders, and then also Navarre is our middle school, so it would be all 6th through 8th at Navarre Middle School as well.
Okay.
So the guys do a really great job working across those age ranges. They're not so much for the littler kids who aren't really thinking about some of the more complex life skills yet.
Yeah. Yeah. And probably the opportunity for mentorship is probably more meaningful.
Absolutely. And outside of the scope of this, we're trying to grow that with Big Brothers Big Sisters. We're deep partners with Boys and Girls Club. So hopefully beyond just what we're doing in the scope of this grant with Gentlemen Scholars, the mentoring will continue beyond that.
Okay.
Great. Thank you very much.
Thank you.
Thanks, Ryan. We'll move to our last and final core public health service category, tobacco prevention and cessation. I'd like to invite up Latoria Green, who is with St. Joseph Health System.
Thank you and good evening, everyone. And I'm so thankful for those who stuck around. So thank you so much. I am Latoria Green, Director of Community Health and Wellbeing and Tobacco Initiatives with St. Joseph Health System. Also serve as Policy Coordinator for Smoke Free St. Joe. Hopefully you all do know St. Joseph Health System is one of our major health systems in the community. So don't need to run through that additional slide that you have there. We do have a number of different healthcare services as well as providers in our community as well. One of our things that we also have is Smoke Free St. Joe Coalition, which is our local tobacco control coalition. We've had the pleasure of being funded through the Indiana State Department of Health Tobacco Prevention Cessation Commission for the past 13 years to be able to lead this organization. Just very briefly here with our mission, it is to improve the health and quality of life for the citizens of St. Joseph County and to create a culture within the community where the use of tobacco is no longer socially accepted behavior. We're so proud to say that we have a coalition full of professional people within our community, as well as we will say, community supporters as well. Right now, we do have 186 coalition partners who are partnering with us for a number of our different policies that we're working on, as well as our initiatives, a lot of who you've heard presentations from, as well as with the Department of Health being one of those partners as well. But then also we do have a 2,000 plus supporter list, which is just our community members who are very supportive of the work that we're doing. Just quickly, just want to say, in terms of some brief statistics here, And here in St. Joseph County, 18.9% of our adults do smoke. 204 births are affected by smoking. Our smoking rate for pregnant women is 6.3 here in the county. For the state, it's 9.8%. 446 deaths are attributed to smoking in our community. 71 deaths occur due to secondhand smoke exposure. With the $88.3 million economic burden of secondhand smoke to our community. When we think of our youth in regards to vaping, in Indiana, 1 in 10 high school students and 1 in 50 middle school students report current use of using e-cigarettes. We know the suspension and expulsion of tobacco possession of youth in our schools only exacerbates the situation and does nothing in regards to nicotine addiction that unfortunately a lot of our youth are dealing with. So what are we going to do about it as far as with our proposal? We will be tackling, of course, the tobacco prevention cessation core service. Our KPIs that we have here is, of course, one that was provided for us, but is not only to create it, but to maintain our tobacco prevention and cessation coalition. But we also will be increasing tobacco cessation resources in the community, as well as to decrease youth vaping initiation, which is one of the areas that we like to focus on, is providing that education for our youth to prevent them from starting in the first place. And that definitely will help with our numbers. So what we will be requesting is that we will request 2 positions. There will be a part-time tobacco cessation coordinator that will facilitate one-on-one and group tobacco cessation programs. And the program in particular that we will have them facilitate is Courage to Quit, which is a tobacco cessation program that the Respiratory Health Association out of Chicago, Illinois has actually provided. We've been doing that program since, I believe, 2018. We also will be hiring for a 0.6 youth vaping prevention coordinator. What this person will do is to go into the schools and provide vaping prevention cessation education. I know that's long to say that, but they will provide that education within our middle schools and definitely in our high schools, as well as partner with youth serving organizations where we can come out and do presentations as well. Another task will be promoting and overseeing our Voice initiative. What this is a statewide youth empowerment program that's hosted through the Indiana State Department of Health. And what it's about is encouraging our youth, not only educating them about the dangers in regards to vaping, but also the tobacco industry and how they're very deceptive in their marketing, how they're placing the retailers in close proximity to our schools. And it definitely, when we think about the flavors of these products, that we know that's nothing but to actually hook our youth to their products. When we look in terms of our goals and our objectives here, our goal, of course, with our tobacco cessation coordinator, that they will be conducting no less than 3 cohorts per quarter. This will be open to all of the community to be able to participate. We are currently offering this virtually as well as in person. Our plans is not to offer it as a hybrid, but to do either or, and also to have them at locations throughout the community as well. The tobacco cessation coordinator will provide these sessions to at least 150 participants. For our youth vaping prevention coordinator, they will conduct weekly prevention education sessions at local schools and those youth serving organizations with the goal of reaching 1,000 youth through these educational sessions. Timeline, and I'm so sorry, it looks a lot of words, it's up there, but primarily what we'll need to do is to hire for both of these positions. We definitely will be having recruitment for all of our tobacco cessation programs. So whether that be going to community events, getting referrals from our great community partners as well. And then also with our youth coordinator is being able to, of course, getting that recruitment in by partnering with those schools and those youth organizations to come in and do those presentations, as well as to be able to host as we call tobacco holidays, which is just events to be able to provide awareness, which is World No Tobacco Day, Take Down Tobacco Day, as well as No Menthol Sunday. And
Great.
any questions?
That's important stuff. Any questions? Thank you very much, and thanks for hanging in there with us.
Thank you all. Thank you. Thank you.
Thank you, Robin. Doctor, any closing comments or on all that?
No, I just wanted to say thank you so much for all the excellent work we're doing in the community. And there's so much more that wasn't even presented today. So just excited about the opportunity for future collaborations and hoping that we can get some support from the board as we move forward with these recommendations for the utilization of our total grant that we wanted to award the community.
Great. I just want to commend you and your staff on the, setting this vision in place and then actually executing it, this grant program. I can't imagine how these dollars could be more impactful to our citizens and the way you've moved this program forward. And just thank you all for all the grant people that applied. And for you recipients, we're counting on you to make good use of this money and to make it effective for the health and wellness of our citizens. So, and hopefully it's so successful that we can't help but get the funding for it year after year after year. So thank you very much. With that, would somebody like to make a motion to?
I move to accept the Health First grants that were presented this evening.
Second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Thank you very much, everybody, and thank you for being here tonight. Next item on our agenda, grant requests. We have 2 grant requests tonight. 2390 apply application for Northern Indiana Rural Health Equity Project.
Yes, this is a new grant opportunity that we would like to apply for. The award amount is up to $5,000, and the funding would be provided, would be received to provide education services and increase awareness on preventable cancers in St. Joseph County. An example, we would like to purchase oral testing kits to be able to test for oral cancer.
Thank you. Any questions or comments?
I move to accept the grant request from Northern Indiana Rural Health Equity Project.
I second.
We have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
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 Opposed, same sign. Motion carries. Next item on the agenda, 2391, application for a grant for Healthy Start Initiative, eliminating disparities in prenatal health.
The goal of this project is to reduce the rate of adverse birth outcomes, fetal and infant mortality rates, and to improve the health of pregnant women in St. Joseph County. This would be accomplished through a program targeted towards the population that has the greatest disparity in health outcomes for pregnancy and birth. It will target the preconception women, pregnant women, new mothers, partners of pregnant women, and children under 18 months of age in the following zip codes: 46545, 46615, 46619, and 46628. The award total is $1.1 million per year for 5 years, beginning April 1st, 2024, going through March 31st of 2029.
Great. Any questions or comments? Or I will comment that the application looks very intensive and labor intensive to put together. So thank you for whoever did that.
It's an entire team. So thank you.
I move to accept the Healthy Start.
But
We can do it after.
That's right. Sorry.
I move to accept the Healthy Start Initiative grant.
Second.
We have a motion and a second. Any further discussion?
Okay. First of all, as part of our packet, for example, we got all the application information. I mean, not the application, but like the application. We've had the chance to talk about it. And I think one thing is that I want to be clear on is that even though this money is focused on assisting people in specific zip codes, are we also committed to ensuring that those services are available to all women in the county who might need it through other funding? Or maybe you can talk about that a little more.
Yeah, I think the goal of the health department is to ensure that any mom that needs help in terms of ensuring a safe and healthy pregnancy is able to access that. This is one of the ways that we are hoping to achieve that goal, to improve the maternal and child infant rate in our entire community. This grant specifically requires that at a minimum 50% of the funding, total funding, is spent in those zip codes. However, we're trying to design the program so that we are able to meet that requirement and then expand to other areas that we know that are underserved. If we receive this funding and we were able to provide that care in those zip codes that have an infant mortality rate that's 1.5 times our national rate, then we would be able to spend our other funding in other areas that may not be able to be covered by this. I think the health department needs to think about maternal child health for our entire county and thinking about how we can allocate resources to those different areas with the goal of serving everyone. And if we were awarded this grant, it would allow us to ensure that we were able to reach the mothers where they need to be reached at the areas that we know have the highest mortality rate in our county. So I hope that answers the question.
Yes, I just thought that that was a good thing to kind of be able to have on the record is, when is, when is the application due and when do you think you'll hear back? The timeline.
The grant is, the application deadline is this Friday on the 15th. We hear back in March.
Okay.
And I just wanted to kind of highlight the HE department, Renata, Alyssa, her team, our data analysts, Peter, Brandon, Amy, Robin, and all of us that have worked together with our community partners to ensure that we got letters of support as part of this project, as it's a pretty intensive endeavor. And then the plan would be for the commissioners to formally approve our application for the grant process this upcoming Tuesday.
Great. Any other comments or questions?
Just thank you for all the work
Yeah.
that you put in. I mean, I know John said that, but gosh, thank you.
Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda is old business. We have none. Next, the item after that is public comment. There's a 3-minute limit. If you want to speak, please sign up on the table over there, or no, sign up with Jenny over there. This is a statement that I make every meeting. At our regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may speak only once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during the open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if it becomes personally directed, abusive, obscene, or inflammatory. So with that, Jenny, who's our first contestant?
And I think we're all hungry and tired, so I'm going to defer to next meeting.
Oh, great. Thank you. See you in a month.
Sam Milligan, 17109 Granger. Commend the Health Department and the board for such a comprehensive grant process. One missing piece that we all need to consider, and that's firearm safety. We have far too many children, youths in our community, as well as the entire nation, who are seriously injured or killed each year. We need a program that's put in place for gun safety. We're never going to get rid of them, but we have to be able to have safe environments for our children from the day they're brought home from the hospital. Thank you.
Thank you, sir. Thank you very much. That concludes that agenda item. Next item is the time and place of our next meeting will be January 17th, 2024, 4:30 here on the 4th floor council chambers. Next item is adjournment. Can I get a motion to adjourn?
So moved.
We have a motion. Do we have a second?
Second.
All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. We are adjourned.
I know. Sorry.